kayong pagalitan. That's not on me anymore pag bigla kayong nawala. What else? I think that's it. That's it for them. Okay. Keep your answers brief because the senators have a limited time to ask their questions. So if you have a brief answer, then they can ask more. Unless you don't want to ask them more, then you can use up 7 minutes for all the one question. Pero hingi din sila ng extension, so keep your answers brief na lang. Okay, on that note, I will call on Yusek Lilibeth David, who will present all the budgets of DOH and all the attached agencies. You have the floor, Doctora.
Thank you, Chair. So we'd like to greet everyone here, of course, the Honorable Senator Pia Cayetano, and to the members of the Committee on Finance, and also, of course, to my colleagues here in the Department of Health and the attached agencies. So let's go to the next slide. The outline of our presentation is, first we will present the health sector strategy map 2023 to 2028, then the 2022 year-end accomplishments and the budget utilization trend, and then the 2024 national expenditure program. So to achieve our objectives and vision for universal health care, our strategy in this medium term is the 8-point action agenda, emphasizing the actions to fast-track health sector improvements, focusing on the tangible outcomes for every Filipino, every community, and every healthcare worker and health institution. So just to recount, the first agenda is Bawat Pilipino Ramdam ang Kalusugan, mainstreaming the primary healthcare approach, ensuring that every Filipino experiences and benefits from comprehensive health services without experiencing financial hardship. For the second agenda, it's Ligtas de Kalidad at Mapagkalingang Serbisyo. This is the provision of high-quality, safe, and people-centered services, including access to affordable medicines. The third agenda is Teknolohiya para sa Mabilis na Serbisyo. This is digital health and technology for efficient and accessible health service delivery. The fourth agenda is Handa sa Krisis. This ensures a resilient health system to effectively prevent and respond to health crises and emergencies. Fifth agenda is Pag-iwas sa Sakit, or improved healthy behaviors through the promotion of health-enabling settings, implementation of healthy public policies, and enhancement of health literacy. Agenda 6 is Ginhawa ng Isip at Damdamin, to enhance Filipinos' well-being and ensure quality mental health services. Agenda 7 is Kapakanan at Karapatan ng health workers, to ensure an adequate, competent, and committed health workforce by providing fair compensation, decent work conditions, and opportunities for career development. And Agenda 8 is Protection sa anumang pandemya, to strengthen health systems and structures to prevent, manage, and recover from disease outbreaks and potential pandemics. Before we proceed to our budget in 2024 National Expenditure Program, allow me to present what the department has done. On ensuring that every Filipino achieves the highest level of health by providing safe, high-quality, and patient-centered service, the department delivered the following: 2,372 HFEP projects, a total of 2.8 million patients served by MAIP, 66% currently on antiretroviral therapy among people living with HIV. This is from 34% in 2017. 1.3 million of children aged 0 to 12 months considered as fully immunized, and additional 60 functional specialty centers across all regions are already serving specialized care for Filipinos. On prioritizing healthcare workers' welfare and rights, strengthening our health institutions, the DOH provided the following. As of December 22, the DOH has deployed more than 25,000 HRH to all priority areas. HRH management will be further supported with the implementation of the National Human Resources for Health Master Plan, which is already approved at the NEDA SDC cabinet level. We were able to release 1.67 million health worker claims for enhanced COVID-19 benefits and compensation as of December 28, 2022. 100% of the A1 category are fully vaccinated with primary series of COVID-19. However, only 32% have received second booster. We also have the lifting of the public health emergency, and we transition back to normal setup from the period of lockdowns, remote work, and online classes. On ensuring that each community thrives in the face of challenges, empowering through health promotion and fostering mental health and well-being, the department delivered the following. 523 LGUs were supported and are disaster ready with institutionalized disaster risk reduction management for a health system. Their launching of the health promotional campaigns to increase health literacy of Filipinos through Health is Life, focusing on health promotion on 7 priority areas. The Consultayo, focusing on primary care. The Pinas Lakas campaign on COVID vaccination program. And 32 healthy communities, 9 healthy schools, and 28 healthy hospitals are initiators for working towards a healthy Pilipinas. A total of 362 DOH accredited mental health access sites served essential medicines and mental health consultations to more than 124,000 service users in 2022. Let me present to you now the highlights of the 2024 National Expenditure Program budget of the DOH. As shown in this trend, the DOH budget is increasing since 2019. The DOH-wide 2024 NEP budget, however, is 3% lower than the 2023 GAA level. For DOH OSEC, the 2024 NEP is 5% lower than its previous level. This budget trend includes the allocation for the RLIP and the special accounts in the general fund. The majority, or 66% of the DOH-wide and NEP budget, is allocated to the DOH Office of the Secretary, amounting to 204 billion pesos. The remaining 34% of the DOH-wide budget is allocated to the DOH-attached agencies and corporations. Of this amount, 101.5 billion pesos is allocated for the PhilHealth premium subsidies for indirect contributors and benefit package improvement. Overall, the budget level of most of our attached agencies and corporations have decreased in the 2024 NEP compared to the GAA 2020, but most have slight increases compared to their 2023 NEP levels. We will now
To be
proceed
clear,
with the
Dr. David, let me
Yes.
just, can you go back to the previous slide? To be clear, NEP to NEP is an increase from 2023 to 2024. Let's be clear, because people are watching this hearing live. The reason it is showing a decrease in the 2024 NEP, because you're comparing it to the 2023 GAA, which already included the initiatives of Congress, right? Always yan. Because you really do get support from the legislative. So to be clear, so overall NEP to NEP, nag-increase naman. Ayun, para pag nagtanong ang media, yan na po yung sagot.
Yes, that is true, Senator. Thank you. So we will now proceed with the details of the DOH OSEC budget amounting to 204 billion pesos in the 2024 NEP. This slide shows the top 10 major cost drivers of the DOH OSEC in 2024 National Expenditure Program. They constitute 172 billion pesos, or 84% of the DOH OSEC total budget amount of 204 billion pesos. The 2024 NEP budget of the DOH HOSEC will fund its 8-point action agenda. The succeeding slides provide details, major details of the budgetary requirements per action agenda. Next slide, please. To ensure that bawat Pilipino ramdam ang kalusugan, which is the first agenda, the contributing programs to the funds for this agenda is HFEP, the budgets of the 14 DOH Metro Manila hospitals and 68 regional hospitals, the Malasakit centers, and the Cancer Assistance Fund. For action agenda number 2, ligtas de kalidad at pagkalingang serbisyo, the budget items of the following programs contribute to this agenda: family health, the prevention and control of communicable diseases, cancer commodities in the prevention and control of NCDs, and the funds for the regulatory functions of the Department of Health. For the third agenda, we have a total of 918 million pesos under the Health Information Technology. The fourth action agenda, Handa sa Krisis, is given a total of 690 million pesos, comprising of funds from the Quick Response Fund and the Health Emergency Preparedness and Response. For the fifth agenda, the contributing programs to this fund is the health promotion and environmental and occupational health. For the sixth agenda, for ginhawa ng isip at damdamin, the funds for mental health commodities and the operations of the dangerous drugs abuse treatment and rehabilitation centers are included in this agenda. For the seventh agenda, kapakanan at karapatan ng health worker, the funds for National Health Workforce Support System and the Health Emergency Allowance contribute to this agenda. For the protection ng anumang pandemya, funds for the epidemiology and surveillance, foreign assisted projects, the provision of quarantine services, and the operations of national and subnational laboratories contribute to funding this agenda.
Excuse me, Dr. David, I'll just recognize the presence of Senator Tolentino. Well, since you're the only one here, I would allow you to make a opening statement if you want.
Or just 1 minute.
Go ahead.
I just came from, sorry for being late, just came from a groundbreaking ceremony of a new hospital somewhere in Region 5, Dep't Camarines Norte. A few hours ago, I was there. So it rekindles my desire through this committee to perhaps ask how far have we gone in supporting rural medical infrastructure. Mamaya siguro yan, but babalik po kasi ako, Madam Chair, sa hearing nung kulto sa Socorro. May mga mangyayari po. But administratively, who is in charge? Who is in charge? Who will take the cudgels in defending the budget of this big department? They don't have a secretary here. I'm a member of the Commission on Appointments. The hearing was just suspended, so it would result in the big D. So who is in charge, is going to present? Is there an acting secretary? Is there an officer in charge who will be responsible for all of these budget presentations, Madam Chair?
Yes.
Otherwise, we're talking to a clustered group of individuals.
Di naman sila headless, Your Honor. Actually, all of the senior members of the team approached me a while ago, and they acknowledged nga that, of course, it is a bit of an awkward situation. But as you all know, USEC Dr. Vergere was the OIC for many years and was very actively exercising her leadership, not just in the past year, but even during the time of President Duterte. And Dr. Yusek David is the most senior undersecretary. So I am quite confident, no, under their in the presentation today that they can answer. But I told them to be candid with us if they are asked about a specific policy of the secretary or the incoming secretary that has yet to be confirmed. They should be candid and tell us if they know, they don't know, or and if it is an ongoing policy that they can further explain, then they should explain. So just be candid with us. That's my instructions to them.
The reason I asked that, Madam Chair, is that budget presentations would require answers concerning accountability. And perhaps the head of the department should be the one doing that. Otherwise, we'll be in an autopilot mode. So anybody can be accountable. Is that the...
My understanding is, and that's why actually I'll show you, katext ko ang ating majority floor leader. I'm asking for guidance from Malacanang kasi if the ad interim appointment will be given anyway, then malas ko lang na my hearing is 2 days after the CA bypassed him. But I'm very happy to conduct a follow-up hearing if there are senators who would want to hear directly with him. On my part kasi, as soon as he was appointed, I have been in communication with him. So ako, wala akong problema to conduct this hearing as scheduled. But that is an offer naman I'm making for all of the senators who would want to hear from the secretary himself. But with respect to policies of the various attached agencies and the programs, they have a very competent team naman po.
Madam Chair.
Yes, and let me acknowledge you,
Yes.
our Senate President Pro Temp, Lauren Legarda. If you'd like to make an opening statement, please go ahead.
No need for opening statement. Thank you. Let me just say that I am certain that our very competent USECs and ASECs down the line would be able to communicate the policies of the secretary who still has to be confirmed. I don't think that the DOH body institution system comprised of career people who it may be a headless agency just in so far as the secretary is concerned, but all the systems are covered by the USECs and the SECs. So I am very confident that they will be able to answer our questions. I do not think that they would divert from any policy of the secretary or say anything that would be against his policies. I'm confident. I may not be on texting terms with them, but I am certain they've been there long enough to know that they will not say, this is the policy, knowing that this is the policy of Secretary Herbosa. And Dr. Pergere has so competently shepherded us, the Filipino people, during the dark days of COVID. Dr. David, I don't know personally, but is senior, as you said. And Dr. Ho, however young she is an outstanding young officer of the DOH. So I'm confident they'll be able to more than adequately answer all our queries. But once the secretary is confirmed, if you'd like to have another hearing, that would be good as well, right?
I don't want
Thank
to
you.
have, but I will have one if it is requested by my colleagues. Yes, of course. Okay, sige. And also, since we have 3 of the very active senator here, let's welcome the third arrival, Senator J.V. Ejercito. Dear colleagues, we have actually started with the presentation. If all of you want to have me repeat it, gusto nyo ba? But there's also a copy. Actually, yung pinasadahan lang naman nila pa lang is yung, kumbaga sa SDG, ay yung mga 8-point na priorities nila. And maybe just go back 2 or 3 slides where you show the budget, no? And then if you can bear with me, dear colleagues, I would like them to finish the presentation before we ask questions because otherwise mag-aantay lahat para lang makapagtanong ang isa. But if someone needs to leave, and I don't know if that's you, Senator Tolentino, of course we will accommodate. Just let us know if it's time for you. But we don't want to deprive anyone of that opportunity to ask, of course, with the permission of our most senior officer, Senator Lawrence. So when the time comes that you feel you have to leave, give me a heads up para maisingit po namin kayo. So maybe just a few slides back, pasadahan yung budget. And dear colleagues, you have a copy of the presentation anyway. So Without further, sorry, Senator JV, of course, you may give an opening statement if you want. No, you're good? Okay. Sarap kausap ng mga kasama ko. Puro okay lang sila. So, Dr. Lilibeth, please proceed.
Thank you, Madam Chair. So maybe we'll just recount the major budget profile for the NEP 2024 of the Department of Health. So the slide shows that the 66% of the DOH-wide NEP budget is allocated to the DOH Office of the Secretary, amounting to 204 billion pesos. The remaining 34% of the DOH-wide budget is allocated to attached agencies and corporations. Of this amount, 101.5 billion pesos is allocated for PhilHealth premium subsidies for indirect contributors and benefit package improvement. Overall, the budget level of most of our attached agencies and corporations have decreased in the 2024 NEP compared to the GAA 2023. But as pointed out po by the Chair, Senator Cayetano, earlier, the amounts for the NEP 2024 have even slightly increased compared to the 2023 NEP levels because of the removal of course, the insertions or some of the items that are not necessary already for 2024. Next slide, please. So the 2024 NEP DOH OSEC budget is 204.3 billion. Next slide. Here are the top 10 major cost drivers of the DOH OSEC in 2024 National Expenditure Program. They constitute 172 billion pesos or 84% of the total DOH OSEC budget, amounting to 204 billion pesos. So we're now also showing how the 2024 NEP budget of DOH OSEC will fund its 8-point action agenda, and the details will be in the succeeding slides. So for agenda number 1 in the 8-point agenda, to ensure that bawat Pilipino ramdam ang kalusugan, the following major line items are funded. Fund this agenda: the Health Facilities Enhancement Program, the operations of the 14 DOH Metro Manila hospitals and 68 regional hospitals, the funds for the malasakit centers, and the funds for cancer assistance. For action agenda number 2, ligtas de kalidad at mapagkalingang serbisyo, the funds for the following programs support this agenda: the funds for family health, the funds for prevention and control of communicable diseases, the funds for cancer commodities under the prevention and control of NCDs, and the funds for our regulatory functions. For the action agenda number 4, the Health Information Technology, teknolohiya para sa mabilis na serbisyong pangkalusugan, the amount is 918 million for health information technology. For the 4th agenda, Handa sa Krisis is given a total of 690 million pesos, which includes the funds of the Quick Response Fund and the Health Emergency Preparedness and Response. For action agenda number 5, the funds for the programs that contribute to this are funds from health promotion and funds for environmental and occupational health. The next action agenda is ginhawa ng isip at damdamin, with an allocation of 683 million pesos for mental health commodities, and also the funds for the operation of dangerous drug abuse treatment and rehabilitation centers. For the 6th agenda, kapakanan at karapatan. For the 6th agenda, so let's go now to the 7th agenda for kapakanan at karapatan ng health workers at institution. The funds that support this agenda are the National Health Workforce Support System and the payment of the HEA and the compensation for arrears reckoning FY 2020 and 2022 to 3 million eligible healthcare workers. Finally, the protection sa anumang pandemya action agenda is funded by funds from the programs on epidemiology and surveillance, the official development assistance funds, the funds for the Bureau of Quarantine, and the operations of national and subnational reference laboratories. Moving forward for PhilHealth, it has six priority items for the next 2 years. The first is the Konsultasyong Sulit at Tama, or the PhilHealth Consulta Benefit Package, as we transition to the Comprehensive Outpatient Benefit Package, or the COBP, in the next couple of years. Next is the release of new and enhanced benefit packages under benefit expansion. PhilHealth is currently updating the rates of the top availed packages. The corporation is set to launch the first set of expansion with high-risk pneumonia and acute stroke. Further, other benefits will also be introduced, such as renal replacement therapy and severe acute malnutrition, among others. Third, also as mandated by the UHC Act, PhilHealth is transitioning its provider payment mechanism from all case rates to the diagnosis-related groups and the global budget. Fourth, to sustain the program, we are also guided by our fiduciary responsibility and ensure fund sustainability. While premium rate increases were deferred, the corporation sought other means to strengthen its accounts management, such as various collection programs, with the end of improving collection efficiency. Fifth is to advance UHC deliverables. PhilHealth is continuously adopting new and enhanced technologies to streamline and hasten major processes, such as claims payment, member registration, and collection. These include collaborative engagements with PSA, or Philippine ID System and Death Registry, and the ICT on e-governance, PH Super App, among others. Further, PhilHealth is also committed in fraud prevention and ensuring the National Health Insurance Fund is intact. Lastly, the sixth priority item is good governance. PhilHealth is currently in close coordination with the Governance Commission for GOCCs with its reorganization plan. Next slide. We would also like to highlight that a total of 101.5 billion pesos is allocated for PhilHealth in the 2024 NEP for premium subsidy of indirect contributors, amounting to 80 billion derived from sin taxes, 61 million for Pamana beneficiaries, and 21 billion for benefit package improvement under the UHC Act. So, Madam Chair, maybe we will end our presentation there.
Thank you for a short but visual presentation. I like those visual presentations because well, at least for me, it helps me understand and see a lot of the policies and programs that you're dealing with. I ask my questions at the very end to allow my colleagues to ask first. So the first person who will propound questions would be our Senate President Pro Tem, Senator Lauren Legarda. The floor is yours.
Thank you. Thank you, Madam Chair. First, may I address my question to PhilHealth, and may I know who is the head of PhilHealth? Are you a new appointee so that we get to know them?
Well, Madam Chair, I'm Emmanuel Ledesma, the current PCO of PhilHealth po. I assumed November 28th of last year po.
Of last year, okay. Just so that it's clear, the annual subsidy of the national government to PhilHealth, which is a GOCC, is in the NEP already. Is it your decision how much subsidy PhilHealth will receive as a GOCC, or is it the DOH secretary? How is it done? I'm talking of the subsidy first, then we'll go to your savings, which you can tell us, I'm sure, I think it's 300 billion, if I'm not mistaken. 400 already, okay. So we just want to understand that. And under the universal healthcare, we have our colleague who sponsored that, I think it was Senator JV, but all of us here are authors of the measure as well. May we know whether the point of care for all the, we call them invisible sector, those who don't have IDs, is that really implemented? So to my first question, the annual subsidy, which is included in the NEP, who decides the amount? Because the number of covered individuals might differ year to year, those who died and those who are born. I just want to understand. And then the utilization of your funds, if it's 400 billion, and that's a lot. Thank you.
Thank you po. Good afternoon, Madam Chair, if I may address the question. The decision po is from PhilHealth. No, we are the ones who make a proposal. We send our recommendation to the DBM, to the Department of Budget and Management, and then we leave it up to them to make the final decision po. But the proposal emanates from PhilHealth po.
How much of your funds is utilized for the PhilHealth payouts to Filipino people based on the universal health care? Or do you always use the subsidy for this?
Madam Chair, if I can allow my CFO, PhilHealth, to address the question, please.
Maybe the first question that should be answered is, how much do you have presently? Is it 400 billion?
It's if it's 400, the exact amount, Madam Chair, is 470 billion in cash and investments po. Currently.
470 billion. Where is it lodged? Is it being maximized in terms of the interest? Are you using the interest for PhilHealth operations? And is your subsidy enough? Or you don't need it much because you have 470 billion in cash and in assets? Maybe just understand that.
The funds of PhilHealth, it's very, the charter provides very strict guidelines as to the investments, no? So we're only allowed to invest it up to AAA bonds, no? So we're not allowed to invest it in riskier investments. So it is very safe po. It's very conservatively done, the investments, no? And I hope that answers your question, Madam. So we currently invest it only in AAA bonds. It's cash and in AAA bonds, no? So it's very safe po.
Madam Chair, with the permission of Senator Legarda, germane to the question given, I have records here that in 2024, it's expected that the projected total revenues of PhilHealth would be 167.062 billion, while the operating expenses will increase significantly to 268.576 billion, resulting in a loss of 101.515 billion. And just a few minutes ago, I heard you'll be investing in. Are there investable funds left?
We have like I mentioned, Senator, our current cash position is 466 billion, no? Both in cash and investments po.
So will that include the government's subsidy? Or yung kasama na ba yun?
In my understanding, the subsidy is the annual allocation from the NEP, which we carry into the GAA, aside from your earnings from your 470 billion total investable funds, right?
So yes, Madam Chair.
Kano po ang inyong kinikita? How much does PhilHealth generate in terms of earnings from your 470 billion funds? And how much is your subsidy annually, assuming it is increasing or decreasing? And is that sufficient to cover the needs of the Filipino people, taking into consideration the enactment in the past few years of the universal health care? So the questions are actually very basic. Your source of funds, which is as a GOCC, the subsidy from the NEP, and then your funds, which is 470 billion, and then UHC, covered ba lahat? When I say the invisible population, many years ago, remember before the UHC, they were not covered, yung mga nakatira sa ilalim ng sa kariton or sa sidewalk o yung mga walang card, pero may hindi na kailangan kasi covered na lahat, di ba? So we want to understand that. There's enough funds eh. So there's no reason. Kasi hingi pa ng hingi lahat ng guarantee letter at I still cannot understand why kailangan kilala ang politiko, ang nang mahihirap kung may universal healthcare na tayo at ang daming pera, almost half a trillion pesos ang PhilHealth. And then, mga anak pa isang tanong ko, Madam Chair, you know, the executive department, sila ang frontliners sa government. They have PhilHealth but very limited ang coverage. That's why the Senate has a private HMO because PhilHealth is not enough. So I want to understand that the need for a private HMO, which the Senate, Congress and Senate has it, but the executive department, for some reason, because of a COA memorandum before, bars them from having that. Yes. At sila ang frontliners. Our doctors, our nurses, those in the front lines do not have a private HMO. So why can't PhilHealth have enough coverage to protect the bureaucracy who are the frontliners in implementing all government programs? You have funds. We have a private HMO, but kailangan pa kung okay na ang PhilHealth? Pakisagot lang.
Yes.
Thank you.
Yes. Thank you for your question, Madam Chair. So, for total benefit expenses for fiscal year 2024, Madam Chair, estimate is around 252 billion. Our expected revenues for fiscal year 2024 is around 168 billion. Our net income for fiscal year 2024 is roughly 102 billion. So if we add, Madam Chair, if we add the revenues of 168 billion, roughly, plus the net income of around 102 billion, it will be enough to cover the benefit expenses for 252 billion. I hope that answers your question, Madam Chair.
Can I just add?
Sure po.
Admin expense mo is not part of payout. So what is that?
Where's
Dito, admin. Ito yung mga 16 billion nilagay natin.
So it's included?
268 lang dito.
Yeah.
268 lang.
Madam Chair, so the 252 billion I mentioned earlier, which is for benefit expenses, if we add the admin expenses of 16 billion, which you mentioned, Madam Chair, the current operating expense total would be roughly 268 billion, Madam Chair. I hope that answers your question, Madam.
It's kayo, 269 versus 260.
Yes po.
So you're very, very good.
Break even po. Yes po.
That's why they have no request for additional income for the first time in history.
Yes po. Exactly po.
No request for additional. No request for additional.
You are relying on the income from your 470 billion funds
The request from the national subsidy.
and no subsidy in the net?
Subsidy,
There is.
No, they
80 billion.
they have a NEP of 101.5
Oo.
and their other income is 168. So the total is 269. So wala silang hinihingi na dagdag.
Nadagdag.
I meant the dagdag.
Yeah.
Meron 101.5.
Yeah.
Yes.
Yes. Okay. It's clear, Madam Chair.
Pointing out
Yes.
that in the years that I've
would always-
chaired and the years that I've followed, they always ask in the billions and billions and billions. So it's the first time na wala. Alam ni JV yan, di ba JV?
We are working hard kasi po, ma'am.
So you have the NEP, but for your coverage under the universal health care, to what extent are you covering each indigent Filipino? Ano
What-
coverage ninyo?
Madam Chair, 100% po coverage.
100% saan? Point of care? A poor
Availment
Filipino,
po. Sorry, Madam Chair. Availment po. 100% covered po. Yes. For availment po.
Based on your HLO.
Does that mean
Based on the, sorry, Madam Chair.
if there is a poor Filipino who enters a government hospital and needs medical care, that's 100% covered, right?
Yes po.
If the person needs an operation, would that be covered?
Yes po.
So all indigent Filipinos who enters a government hospital must not be turned away and is fully covered, not just in the emergency room, but for the room and any machine or checkup or operation needed, covered by PhilHealth.
Yes po. Ma'am, to expound on this point, if I can be allowed, I will ask my CEO, Attorney Eli Santos, to discuss the support value, which will explain this more thoroughly, Madam Chair, if that's okay.
I would like to believe that, but in reality, it's not because yung humihingi sa amin lahat ng guarantee letter and we have to adjust the budgets. I'll be very honest, of Lung Center, Heart Center, PGH, East Avenue Medical, lahat, guarantee letter kasi sukdulan na raw yung kanilang PhilHealth, maliit lang, kailangan ng guarantee letter ng congressman o ng senator. So kailangan naglagay kami ng amendment sa mga institusyon na yon kasi hindi sila covered ng PhilHealth. So I want to
Yeah.
understand that.
Can I simplify this? No, this is how you have to answer. I-explain nyo yung packages ng PhilHealth, yung case rate is very limiting. So, pagka may mga ibang pangangailangan na hindi na covered yon and private hospitals cannot afford the case rate, sisingil sila, kaya hindi siya no balance billing. May balance, di ba? Plus, as mentioned earlier, you're going to shift into the diagnostic-related group type of billing, yung batawag doon, wherein more detailed na yung sakit, yung details ng sakit ng tao, so that yung ilalabas ni PhilHealth na pera, alam na alam ni Senator JV yan, detalyado na. Hindi na yung parang, hindi yung estimate lang. So that's why, as of now, na wala pa yon, ang daming balance billing pa. That's how you have to explain it. Kasi nga, ang point ni Senator Loren, laging may humihingi dahil kulang ang nakukuha sa PhilHealth. Kulang. So explain that in more detail.
I'm not even talking about the private hospital. Government institutions, hindi pa rin covered lahat because sir, you paint a rosy picture. Oo. At I think we are streamed live on Facebook. So lahat po ng mahihirap sa ating bansa at maski na dumami ang mahirap dahil sa pandemya, pati middle class, mahirap na rin ngayon, ay papaniwalaan po kayo kung hindi ko kinaklarify ito. Because you said 100% availment. Ang tanong ko, point of care ba sa emergency or maski kailangan ma-confine, kailangan pa may emergency operation, kailangan ba ma-bypass bigla, tapos hanggang recovery, sagot lahat. Tama ba yun? You make the Filipino people expect, ha? Tapos hindi pala. I'm even talking about, let's say sa heart center. Kakaano ko lang, ng hundreds of thousands, sabi niya lahat covered hanggang huli eh. That's why I want to understand it.
I think, Beverly, can you answer that better? Because can you just tell us now, give me examples of procedures that are not covered. Para simple, kasi yun ang gusto ni Senator Loren, wag natin bolahin yung public kasi alam namin na may procedures or yung mga complicated procedures na hindi covered. So, kaya maraming humihingi. Open heart surgery ay hindi covered yun. O, di ba? Kasi hindi talaga covered. Hindi talaga covered. Hindi talaga. Yun.
Kasi ganito po, napakasimple. Una, tinanong ko sa inyo ang inyong pera. Almost half a trillion, 470 billion. Very good, may pera kayo. Tapos, yung kinikita nun, hindi sapat para sa inyong payouts, kaya ang national government, bilang GOCC kayo, ay nagbibigay ng 101 billion. Ipagsama mo yung kita nung 470 at yung 100, sapat lang yun sa payouts nyo. So, nagtanong ako ng simple, under the universal health care, sakop na po ang kapakanan ng bawat Pilipino. Tinanong ko po sa inyo kung point of care lang or hanggang nadiskubre may pangangailangan, lahat ba? Sabi nyo, tanan, lahat. So, hindi naman ganun sa aking karanasan Dahil araw-araw marami kaming personal na tinutulungan at ayon na rin sa aming mga guarantee letters na allowed naman sa amendments. But if we are to believe you, it's a rosy picture for healthcare in the country, which I hope is true. So I want to be enlightened so that we can communicate this to the Filipino people. Ganun lang po. Thank you.
Madam Chair, if I may. Madam Chair, I think I did explain it well enough, no? 100% of the Filipinos are covered, no? However, ma'am, with regards to the total coverage, it's not 100%. Now, ma'am, if I may be allowed, yung movement to DRG will still take a few years, no? So we're still on the case rate basis methodology, no? Now, also to add to that, ma'am, it's been more than 10 years wherein the enhancement of the benefit case packages have been adjusted or have been increased. And it's just this year, early this year, that the top 3 packages have been adjusted. And the adjustments are very huge, ma'am. So
Explain the adjustment so that we'll understand, please.
we will show a chart, Madam Chair, of the adjustments of the first 3 case packages. And then while we're waiting for that slide, Madam Chair, we're in the process of eventually adjusting all of them. But it's only this year, in the last 11 years, that we started adjusting the case packages. In fact, I was telling PBBM that it's only under his watch, and it's been so long.
Okay. If you don't adjust it, okay, tell us the way it is now so we understand.
Okay, we will show, Madam Chair, with your permission, we can show you
Is it ready?
the top 10 case packages.
Gonna show it here?
We'll just, if you need to just give me a moment to pull out the chart,
Of course.
Madam Chair. And
Yes, Madam Chair, we did not just have our Senate President Secretary. Siguro suggest ko, Sir Ledesma, yung
Yes.
Z packages natin so that people would know that in line with the improvement of the PhilHealth, tumaas na nag-level up na rin talaga yung packages eh. Can you show that so that Senator Lauren can appreciate it?
Yes, sir. We will do, Honorable Senator JV. Also, Madam Chair, if I can allow just
You're allowed.
Go ahead lang.
We're waiting for you.
just want to allow Dr. Ish Pargas is the head of our HFPS. Doc, you might want to.
Yes, Madam Chair. For example, what we are doing right now with regard to rationalization of the all case rates is, for example, with the pneumonia, the severe pneumonia type, we cover for a 32,000 case rate for confinement. However, with the rationalization and with the new costing, we are improving this to around 80,000 to cover for the severe pneumonia. So yun po yung mga mangyayari po with regard to the rationalization. With regard naman po to the coverage of, especially for indigents, we do have a financial protection policy which we call the no balance billing, wherein if the indigent members of our society are actually admitted in a government ward facility, then there is a policy that there should be no balance billing at all. Yes. And
See,
even
can I clarify? That's why the people who come to us, kasi a lot of times they don't want to be in the ward. Tama?
Yes.
Doc V? They don't want to be in the ward. So, unless bigyan mo ng another kind of subsidy, hindi sila mako-cover nung no balance billing.
Yes.
And for those, the truth is, kung middle class ka, syempre yung nanay mo, yung lola mo, yung anak mo, pangarap mo naman na hindi mo naman i-ward
Yes.
yun.
Yes.
That's why that is a real problem. And what I understand is, in the construction of new hospitals, I don't know if this is a pipe dream, parang ginagandahan o nilalakihan ang mga ward in the sense na mas marami tayong maa-accommodate dun sa ward packages natin na if they normally don't want to be in that ward, eh magaganda na yung ward na hindi naman nakakahiyang i-ward mo yung mahal mo sa buhay. Yun yung pagkaintindi ko. Tama? O yan, they are nodding their heads.
Turn on your microphone.
Doc, Mike.
Under the UHC law, we are instructed to have a 90% of all beds in the government facility to be considered as ward, and specialty hospitals for 70%, and in the private, of course, it's at 10%. And so it is mandated already by the ward. And tama po kayo, may mga hospital na po ngayon na pinapaganda ang mga ward kasi most of the patients are really going into there. Yes.
We have the answer to my question. So you meant by 100% of Filipinos, but to what extent are the very poor or the indigent covered? We just want to understand, sir.
The cases covered.
Yeah,
I
which
think-
cases?
Which of the, so give us a.
For all cases po, our members, not only the indigents, but every Filipino are covered by PhilHealth except po for those which are, for example, dermatological cases, katulad po ng mga pagpapaganda, pagpapa-nose lift, pagpapaayos ng ilong. So lahat po yun ay hindi kino-cover ng PhilHealth. Otherwise, all cases are covered by PhilHealth. Meron lang po, sa ngayon po, meron tayong limitation with regard to paggamit po ng benepisyo. For example, we have this rule that within 90 days, hindi pwede siyang magamit muli for the same case or the same period of confinement. Hindi po siya pwedeng magamit within 90 days. Kung halimbawa po nag-typhoid ka today, after 90 days, saka po uli siya magagamit.
Yeah, but your example is a bit not common. Sino ba naman napakamalas na within 2 months nagka-typhoid ulit?
Yes.
Nagka-typhoid na ako during the bar, just before my bar exam.
Yes.
Hindi naman naulit yun, no? Pero yung iba kunyari pneumonia, pag matanda, malaki yung chance na pneumonia ulit yun, correct?
Yes.
So yun yung mga situations na hindi nako-cover. Kasi may 2 months ka na
Yes,
bawal,
Madam
tama.
Chair. Yes, Madam Chair, but we do have, of course, different levels of pneumonia, like the moderate to severe type. So, mako-cover naman po yun.
So kung na-severe ka today, tapos after 2 months, moderate naman, pwede pa.
Yes.
Pero
Yes.
pag na-severe ka today at ma-severe ka ulit, hindi na pwede.
Yes, Madam Chair.
Yun.
As an exemption.
Wag kang masisibir na 2 beses.
But the coverage, may I understand, the coverage is not 100% of the bill.
Madam Chair, what we cover for now, right now, is as we pay through package payments or again, case rates po. So, hindi po siya yung kabuuan ng bill, maaaring kabuuan ng bill, pero ang amin pong pagbabayad ay through package payments, katulad halimbawa po ng pneumonia, kung moderate type po ito is 16,000, kung severe is 32,000, kung halimbawa po ay cesarean section, it's 19,000, kung kidney transplantation, it's at 600,000 pesos.
Doc, may kasabi na rin siguro with the indulgence of Senator Lauren, yung Z packages, yung open heart surgery, breast
Yes.
cancer, ano nyo, para lang at least ma-appreciate natin that it indeed it has leveled up yung ating packages.
Yes, Madam
Siguro
Chair.
yung
We also cover for catastrophic cases, and mostly these are the cancers and surgeries. Katulad po nung nabanggit ko, part of this would be the kidney transplant, which we cover for 600,000. For colonic and rectal CA, which we cover for 450,000. For breast cancer is around 100,000, which we are actually reviewing it right now. For cervical CA, we have 150,000 and 175,000 coverage. And the open heart surgery, which we cover for 350,000 package po, including the ventricular septal defect for the children.
May I know the difference between the legislature and the executive departments, why there is a need for a private HMO for both houses of Congress and the executive is not allowed because sabi nila there's already PhilHealth. We also have PhilHealth, but we have a private HMO. So I'm not certain whether PhilHealth would be able to answer that. Are you able to cover all the needs for those in the executive department?
Madam Chair, there was this COA observation that government money should not be used to get a private insurance. And so PhilHealth is now tasked to come out with a insurance that should cover any or on top of these regular benefits that PhilHealth is going. So right now po, we are designing another insurance package which we are calling PhilHealth Plus, that is for additional premium for additional benefits, Madam Chair.
Can I just make a quick comment? And when Secretary Ted attends either next hearing or when I talk to him, there's always been a discussion on that, whether PhilHealth should offer a premium package or not. Kasi in the beginning, I also felt na mag-offer na lang kayo ng premium package para dun sa gustong magbayad ng premium. But on the other hand, you know, in the same way that in education, we have public-private, we work with the private sector as well. May nagsasabi din na pabayaan nyo na yan sa private sector kasi sila naman ang nagki-cater sa needs ng mga private. So I don't know. I will want to wait to hear from the secretary as he is your chairman of the board, 'di ba? So yun lang naman ang comment ko doon.
Yeah.
Madam Chair, aside from it might be perceived as discriminatory.
Yeah, yun na.
Discriminatory. You have the equal protection of the laws and you're utilizing government funds. So baka may ganong perception.
Madam Chair, if I can be allowed to make a few comments to the earlier very good question of Honorable Senator Legarda. No, Madam Chair, we have PhilHealth has a support value of 65.89%, which means that for every 100 pesos in hospitalization costs, PhilHealth shoulders on the average 66 pesos. No, 66 of the 100. Furthermore, support value is higher in government, which is roughly 80%, compared to private facilities, which is around 60%. No. Also, Madam Chair, I would want to add, with regards to the earlier question of, again, Honorable Senator Legarda. So, it's been 10 years since we've adjusted the case rates, and we've started earlier this year. We've adjusted the top 3 case rates. No, if I may be allowed, I will enumerate what these 3 are. So the first one is, my apologies, we don't have a chart to show in the screen, no. But the first one is for pneumonia high risk. The all case rate used to be 32,000 pesos.
And the new is 80. You mentioned that already.
The new is 90, ma'am, 90, Madam Chair. So with an increase of ACR of around 182%. The second one, Madam Chair, is acute stroke hemorrhagic. The all case rate, published rate is 38,000, and the new one is roughly 80,000 for an increase of roughly 110%. And the third one, Madam Chair, is acute stroke ischemic. The all case rate, published rate is 28,000, and the new case rate is roughly 76,000 for an increase in ACR of roughly 170% po. Thank you very much po. Also, lastly, I just want to mention that the number of hemodialysis sessions, we have increased from the original 90 sessions a year. It's now been increased to 156, which is the maximum allowable. That's computed by having a maximum of 3 dialysis sessions in a week times 52 weeks in a year. No? So, Madam Chair, this was increased already, and I don't know if you recall, Madam Chair, in the last SONA of PBBM, this received the loudest applause, no? And a lot of the congressmen were very happy with this development. I just wanted to mention that. Thank you, Madam Chair.
Will you finish your packages? You said you're reviewing it now after 10 years or 11 years?
Yes, we will finish targeting, if again, Madam Chair, if I can allow Dr. Ish to answer the question, to address the question. Thank you.
The first three packages po are being routed now for approval. So hopefully within the year, or actually within October, it will come out. And then we are now in the second tranche, which would include the dengue, the chemotherapy, the bronchial asthma, and the cataract to be included in the next round po. So hopefully within the first quarter of next year, we will have the second tranche.
How are your operations affected by the cyber attack on the PhilHealth information? I think every government agency, including GOCC, especially those who are serving our public through valuable information, must have a digital protection. We just came from the
Yes.
DBM hearing, and they speak about digitalization. And how are you protecting yourself? And how has it affected servicing the Filipino people if this attack on your website, would you consider it a major attack on your website? Did it affect your providing service to our people? How are you able to retrieve the information? It's being sold on the dark web, is it?
Madam Chair. Madam Chair, can we be allowed to address the question? Yeah. Thank you, Madam Chair. If we can allow, Madam Chair, if we can allow our IT group to give a very, very brief description on what happened and how it's affecting PhilHealth's operation. Before I pass on the mic, I just want to mention that I think it's very most likely that within the day, all the operations will be back to normal. But anyway, I'll just, if I can maybe allow Sir Nelson to, or if I may be allowed CEO to give a brief description on what transpired. Thank you, Madam Chair.
After this, I'll yield to the chair and to Senator JV because I've exceeded my time. But on the second round, Madam Chair, may I ask the DOH? Yes. Thank you. But just answer, please, the cyber attack.
Yes.
And how that was last week of September,
Yes, po.
right? So it's been a week?
Yes,
A
po.
week.
Roughly around 7 days po. Yes, po.
Okay. So paano kayo naapektuhan? Paano nyo maprotektahan ang lahat ng data of 110 million Filipinos?
Yes.
O paano yun?
Yes, po. We shall address the question very, very briefly po. Thank you po.
If I may, Madam Chairperson, Honorable Senator Legarda, I will explain the general picture of what's happening, and for the details, later may we allow our Senior Manager Nelson Rivera to answer the same.
Po,
Yes, ma'am.
no, we know the situation. Just how
Okay.
how does it affect your operations, and what are you doing to prevent it from happening again? And are you able to retrieve all your information which you supposedly lost? Yun lang po.
Madam Chairperson, Honorable Senator Legarda, we turned off all our systems starting September 22, and we have not yet turned it on. So what we are doing right now is all transactions are offline, and we resume operations, meaning membership, employer submission, payment through over-the-counter. Our benefit availment continues. We have already informed our partner providers that while the system is turned off, they can they can still submit claims or prepare submission of claims. And the moment that we turn the system on, we can now receive the submission of claims. At present, Madam Chairperson, to confirm the statement of our President, we are set to turn on our systems today, but we are still completing the preventive measures before we turn it on. We are targeting to turn on our PhilHealth website, the member portal, as well as the e-claims. And this will address the issues of our members as well as our partner providers, Madam Chairperson. So at present, to reiterate, we are offline and all our transactions are over the counter. Madam Chairperson, please. Thank you very much.
Madam Chair, I just wanted to add that we are working very, very closely with the DICT on this, no? And we're coordinating with them 24/7. And they are assisting us fully on this. Just wanted to mention that, Madam Chair. Thank you.
Senator JV or Senator Lauren, since we're already on the topic, tapusin nyo na tong topic na to. If you have anything else to ask on this topic.
Siguro before yung concern ni Senator Lore, no? Because yun nga, the way we package is because of, people think that because of universal healthcare, everyone is covered. Tama po, covered lahat. Pero yung sa billing, for example, how does PhilHealth compute? Siguro yung gusto malaman ni Sen Lore, no? Because, and also probably if si Secretary ASEC Beverly or si Secretary Berher can answer, yung out-of-pocket expense natin, how has it improved pre-UHC and post ngayon that we are already improving. No, siguro we will go to that. I think it has greatly improved, no? Siguro si ASEC Bev muna and then our Secretary Berher can answer. And then we go back to PhilHealth para we can understand better.
Okay. Thank you, Senator.
Yes. Yes, Madam Chair, Senator JV, magandang hapon po. The out-of-pocket expenses have improved. We had around 52% in 2014 and right now, currently, based from the Philippine Statistics Authority, Philippine National Health Accounts, we now have 41.5% as out-of-pocket expenditures.
So Sec, how it has improved greatly, no? Dati 50% or more. Now it is
41.5%, Madam.
So we still have a long way to go until the full implementation. So, yun po, Sen. Lauren, I think listening naman yung out-of-pocket natin has improved. Yung sa PhilHealth na lang, Mr. Ledesma, please continue.
Yeah.
Yung how the PhilHealth's portion is computed, no? Siyempre, yung packages,
Yeah.
tapos, kasi parang ang nagugulo kay Senator Lauren, but in spite of that, ang dami pa rin humingi ng guarantee letters.
Yes. Thank you, Madam Chair. Thank you, Senator JV, Senator Hercito. Actually, I want to mention two things. No, the first is, I think the best way to look at this is when I mentioned the support value earlier, which is 66 pesos for every 100 pesos. No, so I think that's roughly how much is spent. No, but in line with that, and I think more importantly is, it's very clear now. Although it took PhilHealth quite some time to adjust the case rates, no. In fact, the joke po is like with inflation and with everything, lahat na tumataas except the case rates of PhilHealth. Again, I'm happy to announce to this honorable committee that we've already started with the first three, and that's really where we are moving on to start accelerating the adjustments of the enhancement of the other case rates, no? And one of the reasons po we are asking for a bigger budget this year is because we want to focus really on the enhancement of the benefit packages, principally aside from, of course, the digitization and the computerization of PhilHealth, no? So I hope that answers your question, Senator JV, Madam Chair.
But to answer his question, follow up lang JV, to answer his question, you replied by repeating what you said na
Support value.
if 100 pesos, 60% ang covered ng PhilHealth, right?
Yes po.
But the cost of delivering services is not the same per hospital. The public is cheaper, the private is more expensive. That's why angal sa inyo ang private hospital. Tapos delayed pa yung pagbayad sa kanila. How do we resolve it? Tapos nag-down pa yung system nyo.
Okay.
So on behalf of the private hospitals, naiiyak ako because I chair two very important budgets, health and education. And in both sectors, private participation is important. Walang balak ang gobyerno na public lang lahat.
Okay
We
po.
want the privates to be our partners in good standing. And just like the schools na maliliit, nagsasara, yung hospitals din na maliliit, nagsasara din because hindi na nila talaga kaya mabuhay na daig mo pa yung, I won't name the department store na kilala na 90 days magbayad. Eh kayo parang 360 days.
Ma'am, if I may be allowed to address the question. Yeah, thank you very much, ma'am, for the question. No? Very good question. In our just recently concluded budget hearing with Congress, no, during the committee hearing po, this question, the question with regards to benefit payments to hospitals was brought up, no? And they were saying, basically they were saying sa dami-daming pera ng PhilHealth, which is roughly 470 billion, bakit yung total of 27 billion payments to hospitals hindi pa nababayaran? So to address the question, Madam Chair, I committed that within 90 days from that time, that hearing was on September 6, Madam Chair, I committed that all or almost all of the 27 billion will be fully paid within 90 days po, no? Now, just to give you an update, Madam Chair, I'm happy to update this honorable committee that that hearing was on September 6. Today we are September 28, no? Of the 27 billion pesos that PhilHealth owes these hospitals, we have already paid, and I just want to highlight, Madam Chair, that we were going to use the DCPM method, which is a debit credit payment method, so there'll be faster reconciliation po, no? But anyway, we still haven't used the DCPM method, but as of the promise I made, paying the 27 billion within 90 days, it's only been 30 days of the 90 days that I promised, and we have already paid 73% of the 27 billion. So what I'd like to say, Madam Chair, is we are well on track. And if I may add also, Madam Chair, that a few days before that hearing, we had a Zoom virtual private meeting with the heads of the different hospitals associations of the Philippines, and we asked them, we told them that we were about to present to Congress to have a budget hearing. We asked them if they were happy with the services of PhilHealth, specifically the payments of the claims, and all of them unanimously said were satisfied with the way the payments were going. So I just wanted to highlight that, Madam Chair, and hopefully that addresses your question. Thank you very much, Madam Chair.
If that is accurate, which of course on face value, I believe you, then congratulations.
Thank you, Madam Chair. Thank you very much.
Ayun. So how, siguro ang tanong ko lang dito, as mentioned by our secretary, nasa 40% na yung out-of-pocket expense. A big improvement, no, pre-UHC. Our target really is to further lessen the out-of-pocket expense. So how we have to, ano bang kailangan natin gawin? What are programs that we have, that the PhilHealth has in store, so that this can be realized? If we can lower it to ngayon nasa 40 pesos, kung maging 30 yan, probably that's a very welcome, that would be a big relief for a lot of our Filipinos. Sige po.
Yeah. Senator JV, excellent question. Actually, thank you very much. We're so happy that you asked that question. Before I pass on the mic to Dr. Ish, no, he wants to discuss, I think, consulta and other methods. No, I just want to highlight, Senator JV, that ever since I joined PhilHealth, no, our trust really is, my trust really was to improve on 3 fronts. No, the first one is digitalization and computerization, which we feel PhilHealth is backward on most of it. The second one is to increase the number of our employees from the we're currently 7,000 employees, Senator JV, and we're going to increase it to roughly 10,000. No, we have a pending reorg with the GCG, and it looks very likely it will be approved, and we will be moving towards that front. No, and the last is, which I discussed earlier, the increase of the benefit packages, which haven't been touched for so long. No, so now with the permission of Madam Chair, if I can allow Doc Ish, and I think our SVP Renette also wants to comment on the Consulta program, which I think will address your question also. Thank you, Madam Chair.
Please go ahead. And also we want to know, because one of the salient features of UHC is to strengthen the preventive side. So where are we right now sa Consulta? How is it? How's the availment? No, our people, ang kulang kasi natin sa PhilHealth, and for UHC for that matter, we lack the information drive. People do not know. Diba? Kagagaling lang namin sa South Korea, Singapore, OFWs there, they were up in arms na tumaas tayo nagtaas ng rate, hindi nila alam yung packages that also leveled up. So I think that's where PhilHealth and other government agencies, even DOH for that matter, doon tayo nagkaroon ng pagkukulang eh. We lack the information drive. People do not know that they are entitled to these packages. Diba? Sige, Doc Ish, sige, please.
Madam Chair, good afternoon and thank you. Aside from the plans that our president has already said, we are also embarking on the way we actually pay our providers, and we are changing the way we pay them through a provider payment mechanism, which we call the DRGs and the global budget. But as it is, as a preparation to these changes, we are actually costing the healthcare services right now such that we can actually approximate the amount of the healthcare services that we can develop as a package. So in this case, we would be able to, again, approximate the amount of healthcare costs that a facility has been giving, but we are coupling this particular facility with a co-payment or a fixed co-payment. That is to make sure that the effect of these prices would not be inflationary for our members. With regard to our preventive type of benefits, we all know that we already have a lot of inpatient packages, but we started already with our primary care, which we call Consulta. The Consulta is a primary care benefit packages wherein there is a free consultation, 13 laboratories, which are also free, and 21 essentials drugs, which are also free, which are given or to be given to our members who are actually needing this. At the moment, as of August 30, we already have around 2,460 accredited Consulta providers nationwide. Our target for the year is around 2,500. For next year, it's around 3,500. And by 2025, it's around 5,000 accredited Consulta providers. We already have a little less than 20 million Filipinos registered in these Consulta providers po. And really, tama po kayo, what we need right now is an information campaign and for everyone to help us informing every people that they should be registered to these Consulta providers for them to be able to get these benefits.
So to date, Consulta started last year.
Yes, Mr. Chair.
So how many patients or Filipinos already availed of the services, yung free checkups, lab tests, meron ba kayong data?
We have,
Kasi first year pa lang naman eh. So
yes po, we have already registered as of to date around 17 million Filipinos to these Consulta providers, and they are qualified already to avail of the benefit.
yung avail kaya, meron ba kayong data on yung actual availments already? But it's understandable since it's the first year, probably next year. Okay then.
Magkano yung FPE natin?
Senator, we're just getting
The data.
I think
Okay.
the data you're looking for is the FP, the first patient encounter.
As of June 30 po, we have around 2.3 million who have already gone first patient encounter.
Yes, that's why I'm emphasizing on information drive because as I mentioned, as UHC, one of our main features is the preventive side. Kasi sabi nga natin, Madam Chair, yung curative becomes more expensive for the family and for government as well. So we really have to strengthen this preventive side. Na kaya nga, I will ask also yung DOH later na sana ba tayo dun sa mga super polyclinics, super health centers, because that will play an essential part in the success of the UHC by strengthening the preventive side. So siguro yun ang ano natin dapat ang PhilHealth is more information drive so people would know kasi marami sa mga tao hindi talaga alam. They don't even know that UHC has this PhilHealth already has these packages that they can avail. Kasi pag merong na open heart surgery, kidney transplant, parang nawawala ng pag-asa eh, no? So, I think you really have to double time on information campaign.
If I may be allowed, Senator JV, to respond to your question. Yes, we hear you. We hear you. In fact, information dissemination is what we've been working on since I joined PhilHealth. And to add to what you mentioned also, it's not just that. Even the fact that 100% are members of PhilHealth. A lot of people don't know. They said, oh, covered pala tayo ng PhilHealth. No? So, we hear you loud and clear, Senator. We're working on it. We will have to disseminate the information more properly. No? And one of the areas we're using is this Consulta Caravan, no? which will allow us to properly disseminate all the needed information to the people, no? As fast as possible. No? So, thank you very much for that, Senator JV, and we are definitely addressing the issues. No, thank you.
And likewise, before we move on, Mr. Ledesma, would you say that PhilHealth now is financially healthy? Because the universal healthcare, our healthcare system depends so much on PhilHealth and yung primary agency natin. To cover. Sa ibang bansa, may dalawa, tatlo. But here, we have no choice. We only have PhilHealth. So how is the financial condition? Is it healthy? Because how can we provide healthcare if our provider is unhealthy?
Thank you again, Senator Ercito. Yes, we are financially healthy, but I'd like to add though, like I said earlier, we have plans of improving our digitalization. We have plans of increasing our employees from 7,000 to 10,000. We have plans of increasing our benefit packages, which haven't been touched for more than 10 years. So, yes, we are financially healthy, but at the same time, we've been telling this to DBM and to the lawmakers. We need a lot of funds because we have to sustain, and we need to improve the services to the people on all fronts. No, thank you, Senator.
Yes, you have a very tall task, no? Because with the passage of UHE, it's ensuring the whole population. No, it's not easy, but I'm glad that at least to hear that financially healthy now, PhilHealth, because as mentioned by our chair earlier, for so many years, the PhilHealth has been asking for more by the billions kasi nga talaga may problema. No? So I'm hoping that you will continue the reforms that you started. We really have to plug the hole, so to speak. No? And siguro, tanong ko lang din, we have, because the time that I was in the Senate, there have been a lot of investigations on the scandals concerning PhilHealth. So how are we on that front? Have we improved? Have we plugged the holes? Wala na bang rito? Wala na bang nagkakaroon ng collusion? No more cataract scams, upcasing?
Thank you for your question, Senator Ejercito. I just wanted to mention a few things. No, first is the client satisfaction rating of PhilHealth. I think the last survey showed it was as high as 94%. No, and then secondly, Senator JV. Like I said, we had a meeting very recently with the heads of the hospitals associations of the Philippines, and all of them are very satisfied and happy with the service provided by PhilHealth. And thirdly, I'd like to mention that in the last SONA of PBBM, I was told that it's been 4 or 5 years since PhilHealth has been mentioned, no, of any accomplishments. But in the last SONA of PBBM, it was very clear that PhilHealth and DOH and the health sector in general had a lot of mentioned accomplishments, no, and including what they were saying was the loudest applause with the increase of the hemodialysis sessions to 156. So with those points, Senator Ejercito, I'd like to think that at the very least, PhilHealth is moving forward. Of course, nothing changes overnight, but I think, Senator, it's safe to say we are on the right track. Thank you, Senator.
Well, I'm hoping that yung pong involved before sa mga scandals and scams can be prosecuted so that it won't happen again. Because hindi tayo mayamang bansa, whatever funds we have or PhilHealth, it should go to those who are in need. hindi mapunta rin sa ilan na gumagawa ng mga sindikato, no? So that I hope that you can also give preferential attention. As I said, we really have to make sure that the funds go to those who are really in need, sa beneficiaries talaga.
Yes, duly noted, Senator Eristo. And again, like I said, no, I think it's information dissemination and information communication, and we are trying to address all of this to the best of our
And
ability.
also,
Senator.
while we are still far from it, it's a work in progress. But hopefully, if we can lower yung out-of-pocket expense, I think yan yung tinatanong ni Senator Legarda. Nagtataka siya, dapat cover na lahat, pero ang laki pa rin nung nilalabas ng iba, no? So it's, I think that's what we really have to work for. If we can increase the packages, probably increase what we can do para ma-lower natin yung out-of-pocket expense.
Yes, again, Senator Eristo, yes, we hear you loud and clear. And I also just want to add to what you mentioned, Honorable Senator, that it's very clear in the UHC law, no, the NBB, the no balance billing of 100%, especially for the indigents. No? So, well, again, I think we're going towards that direction. It may take some time po, pero we're trying to move forward po as fast as we can. Thank you po.
Yes, Senator Lauren.
Yes, Senator JV, with your permission. The good gentleman mentioned about the challenge of communication. In this digital world, that should not be a challenge. And if I may suggest, all your new packages and everything that you claim you're doing, so thank you for doing that if you are, and I hope you are, just roll it out among all the leagues. Leagues of provinces, leagues of cities, leagues of municipalities, and barangay leagues, although there's going to be elections in a month. All of these LGUs have Facebook. Alam mo, pag nangangampanya, Facebook. So all the good news and the innovations you're doing in field health and the packages and all of it, iligay nyo dyan. Not just in English, in Filipino and the various languages, major languages, whether Ilocano, Hiligayno, Nilonggo, Cebuano, Bisaya, Kapampangan, pa-translate nyo. Ang dami-dami nyong pera eh. Dapat yan, iparating nyo yung ginagawa nyo. At saka sa simple, step by step. Kama mismo, Senador, na ko-confuse pa sa mga sagot nyo na simplified na. What more? Yeah, right? So it should not be difficult because of course when you sit where you are as head of PhilHealth, how do I communicate this to my public? But you want it to be used, right? So use the political networks. Use even the government channels. Use PCO. Not government channel, TV channel, but the government media infrastructure, right? Because we know when something goes wrong, it goes viral. But this is good news. It should go viral. Diba, good news and utilization of government packages to help our people for healthcare must be disseminated down the ground. And I'm not even talking far of someone living up in the mountains or in islands. Even here, those in the street nearby, those who live by the sidewalks or under the bridge or in a kariton, dapat maintindihan nila kung paano gamitin ang PhilHealth maski hindi nila kami kilala at maski ang mayor walang pirma. Na pag inuubo, gaya ng bumahing, ay lumapit sa pinakamalapit na ospital at libre lahat. Hindi dapat mahirap ang komunikasyon dahil nga digital na lahat ngayon. Bakit ang chismis ang bilis? Bakit ang fake news mabilis? Bakit ang accomplishment ng PhilHealth at kung paano kayo gamitin ng nahihirapan kayong paratingin yan? Dapat mas mabilis pa kayo sa chismis na makalat yung impormasyon.
Can
Okay.
i-hire nyo si Senator Lauren na maging TikToker nyo ng benefits ng PhilHealth. I'm not kidding. It's not a joke. Ang TikTok now, di sabi nila, in the age of digital transformation, nababawasan daw ang mga nagbabasa ng libro. But apparently, people who are proponents of reading, going back to reading books, are even promoting book reading on TikTok. So gamitin nyo si Senator Lauren or whoever. Ano lang naman.
Of,
Di naman, but I'm just saying, di ba, use technology to promote your causes, your benefits. And when you talk about it, in the same way na nagulat si Senator Lawrence sa sagot nyo na okay na kami, we don't need funding, 100%, hindi yun ang nararamdaman ng tao because upon further discussion, lumalabas naman talaga na hindi naman nyo kayang sagutin lahat ng klaseng sakit with all the repercussions of that sakit, including yung mauulit yung hospitalization nila and so on and so forth, diba? So that is communication, okay? And if I may repeat, bago lang kayo, di ba, sir? During the time of COVID, Yusek Vergere will attest to this. WHO included communication as the top 4 parang, what do you call it, steps or what needs to be done. Communication was just as important as the delivery of the health service, as delivery of the vaccination, communication. Okay?
We have internal team, Madam Chair. If I can,
Ito question ko, sorry ulit ha.
Yeah, yes po.
Huwag ka magala, tatlo lang kami, makakasalita ka. Do you have a young, and not to be age discriminatory because both Senator Lauren and I are past our 30s. Si JB baka 40s na. Kami past our 30s lang, masasabi ko sa inyo. So not to discriminate, no, but I'm not kidding. Even my daughter who's 25 told me that dun sa mga causes ko, sa mga passion ko, you have to get this young digital savvy because alam nila yung uso. So I'm not saying na my 50-year-old staff or even I cannot adapt. I can, but I have other work to do. So ang tanong ko sa'yo, anong average age nung communication staff mo? And not, again, to be discriminatory because kami ni Lauren, we are in the 30-plus bracket.
Madam,
You're correct. Ito na lang,
Correct the chair,
30-plus bracket.
30-plus bracket in my first term and I'm on my 4th term.
Oh, bahala na kayo. Bahala na kayo. Hindi, ito lang, kabracket pa namin sila. Kabracket niya.
Madam Chair, ka-bracket po kasi nasa mga 30s rin sila po eh. So halos same age lang po kayo.
One bracket younger than Doc Bev Ho, kasama sa team. Okay? That's the truth. Yun lang yun.
Yes, but we will.
Okay.
A submission. Before we approve their budget, I don't know if
Confidential information, yung bracket ng mga staff.
no, the information on how they will diba?
Yeah, Madam Chair. Yes, we will submit very clear, Madam Chair. And I'd like to, in behalf of PhilHealth, we'd like to thank you, the committee, honorable committee, for all your excellent comments. No, yeah, it's all duly noted. And I wanted to add, Madam Chair, Madam Senator Lauren Legarda, with regards to the idea on the LGUs, no, I'd like to say that ever since I joined, we have been closely coordinating. In fact, I'm very good friends with Governor Ray Tamayo and Governor Dax Kua. So we are using UNAP and the League of Governors. We have attended their forums. We have dinners. So we are utilizing the governors to the fullest, their network, no. But duly noted on your suggestion po, and we will try to even utilize it more po. Again, thank you po for the suggestion.
Simple lang po, yung presidente ng leagues, governors, city mayors, municipalities, barangays, and councilors, board members, may mga liga. Tapos, bigyan na nyo yung question and answer na simple ha, hindi yung 100% covered. Ano yung 100% ng Filipinos o ng coverage? Yung maliwanag in English and Filipino. Then, ask them to help translate it. Kung Bicolano sila, in Bicolano. Kung Ilonggo, ganun. Kung Kinaraya sa amin, Kinaraya. Ganon. Then, ask the KWF to help you, government agency, Wikang Filipino, the Commission ng Wikang Filipino. It's not very difficult to do that. Just do the template. We'll help you. Give us a template, Q&A na simple. English, Filipino. Give it to me. I'll help you. Papa, sige na.
Thank you.
Na, Papa-translate ko na sa KWF. Tulong na. We will give it to you translated in the 10 major languages. Just give me the information. Simple ha, hindi term paper. Simple. Frequently asked questions.
Yeah.
Ako na ang gagawa para sa inyo.
Thank you.
Hindi sa TikTok, dahil hindi ako influencer. Yung yung pag bite size kailangan ang inyong pag-communicate.
Thank you so much.
It's really a challenge for us to be able to do that. Yeah.
Thank you so much, Madam Chair, Senator.
I have a surprise for Senator Lauren. So she can comment on the spot on your existing post on benepisyo ng PhilHealth. I think it's short. So let's play it so that you can already comment and tell them now if pasado sa'yo yon o okay lang sa'yo, Senator JV?
Please, go ahead, because we are really emphasizing. Madam Chair, we are emphasizing.
Is on the instructions you want to give them. Baka pag you're a communicator. You're not their market, but you are a communicator. So
Let's see.
parang and if it's, I mean, let's just play it for 2 minutes para at least masabi mong, oh yan pala maliwanag pala o whatever o hindi pala maliwanag.
Meron silang fixing it now.
Yeah, it's a post on their Facebook. Yeah. So while they're fixing it, what I want to
Ilan ang
get-
membro nyo sa
that.
Facebook?
1.6 million.
Ah, marami. Okay.
Ang total members po, Madam Chair, with 1.6 po. 1.6 million po.
Pero ilan ang members ng PhilHealth? Filipino, no?
100% covered po, so 150 million.
Sige. Anyway, while we're trying to load it, Senator JV, you wanna ask?
Again, siguro emphasis ng Madam Chair and also Senator Lauren. Again, it's really the communication. Kasi people do not know the process. They do not know the packages. Sayang eh. They may not know that they can avail of the packages that you are offering already na nag-level up na rin. Hindi na rin nakakaya. Yung Z packages, I saw it. 600,000, 400,000, hindi na mababa. Di ba napakalaking tulong yan sa mga may hirap. Siguro ano ko lang, as suggested by Senator Lauren, go to the leagues, we shall go governors, mayors, League of Cities, and the like. Pero meron kami na-encounter recently as we went on, Madam Chair, we went on a trip to South Korea and Singapore where for the Department of Migrant Workers, kailangan din natin mag-extend ng PhilHealth doon ng representative to explain to the OFWs yung packages. Kasi ang naging lalo na siguro si Yusek Vergeri knows this, naging controversial to nung nagtaas ng premium ang PhilHealth during nung pandemic. It was lahat nun hirap. So anyway, sabi nila they are willing to pay the premium as long as yung packages are okay. Hindi nila alam yung packages eh. Sinasabi nila, nasa isip nila, ba't kami magbabayad ng premium? Hindi naman kami makikinabang, nandito kami sa ibang bansa. Kami pa nagpapaliwanag na ang buong pamilya nyo covered. Diba? Sa Pilipinas, hindi na kayo kinakailan problema kung may magkasakit. Dati kayo rin magpapadala. Ang PhilHealth na ang sasagot. Dapat yun yung mga paliwanag na tingin ko kailangan, lalo na with our OFWs, marami ang hindi alam. Kaya ganun na lang yung reaction nila when PhilHealth increased the premium during the pandemic. Diba? Hindi nila alam yung packages eh. Nagulat sila, gano'ng kalaki. And also, we also committed, in the process, tanin ko rin si Secretary later, ano pa yung amendments natin to the UHC. Since yung parang incentive na sa OFWs, they are willing to pay naman, pero siguro doon sa minimum, sa base na lang, as incentive natin sa kanila for helping our economy.
Thank you, Madam Chair, Senator Ejercito. Thank you for that. Duly noted on all of that. Just wanted to add, Senator JV, that PhilHealth, we send our comms people to the different consulates to inform them of, let's say, the increase in packages, increase in information, and all that. But noted on your excellent suggestion, Senator, we shall comply and we shall try to move as fast as we can on that front. No. Lastly, in addition to that, we're also planning, Madam Chair, to add offices in the different countries, no, Hong Kong, Middle East, and all that, so that at least the information will be disseminated more properly, and then it's more access to our OFWs and the different people in the different countries po. Thank you very much po.
Check ko lang pala, no? You have naman a actuarial team. You have your own, right?
Madam Chair, yes, we do. But if I
Same as before, or did you get a new team, or what? Kasi been working with them.
It's the same as before, Madam Chair, but if I may add, the reason why we have a pending reorg with GCG, because I think PhilHealth in general, among all, not just actuaries, no, with regards to legal, with regards to HR, with regards to finance, we are short on manpower on almost all fronts, no. So we have the same teams as before, but after our reorg is approved by the GCG, like I mentioned earlier, we'll be increasing our number of employees across the board in all regions from roughly 7,000 to 10,000 people. And that includes adding actuaries, lawyers, finance people. And
Yeah,
all.
but in your existing team, do you have a certified actuary?
We do po. Yes, we do po.
You do.
We do
Kasi
po.
I keep getting information that you don't have.
We do po, but I think we could use an increase in number of actuaries. But we currently have po.
Certified.
Certified po. Yes po.
Sigurado kayo?
Yes po. Yes
O
po.
sige, I'll ask you to give the name to my staff, ha? And,
Yes po.
and the CV. Kasi paulit-ulit kong nakukuha yan, and I don't like to perpetuate, I don't want to spread or even tolerate wrong information. So once and for all, you're replying that you have, and just give us the details so that we have it. And I'll be the one to tell everybody who sends me that info that you have. But it's not the first time I've heard it. It's been mentioned to me mga 3 years ago pa.
Thank you, Madam Chair. In fact, we can furnish you the info within the day po.
Okay.
Thank you po.
Anything else? Is the video ready? Oh, yan, Senator Lauren, are you good? Let's play it. Okay, let's play it.
Alam niyo na ba ang iyong PhilHealth Inpatient Benefits? Ang PhilHealth Inpatient Benefits ay mga benepisyo maaaring ma-avail sa tuwing ang isang pasyente ay nangangailangan ma-admit o ma-confine ng 24 oras o higit pa sa isang PhilHealth accredited na ospital o pasilidad. Ang halaga na maaaring ma-avail ng isang pasyente ay natutukoy base sa kanyang sakit na may nakatalagang halaga o ang tinatawag na case rate. Sa PhilHealth case rate, malinaw na matutukoy ang halaga ng benepisyo na dapat makamit para sa isang sakit o operasyon. Covered ng case rate ang bayad ng pasyente sa mga araw na siya ay na-admit o na-confine para sa mga sumusunod: room and board, mga gamot at laboratorio, professional fee ng kanyang doktor. Binabawas sa total bill ng pasyente ang halaga ng case rate at tanging ang halagang maaaring lalagpas dito kung mayroon man ang kailangang bayaran ng miyembro. Narito ang mga halimbawa ng case rate para sa medical conditions. Para sa case rate medical conditions, 70% ng halaga ng case rate ay napupunta sa bayad sa pasilidad at 30% naman para sa professional fee. Narito naman ang mga halimbawa ng case rate para sa surgical procedures.
Just give me a heads up.
Para sa case rate ng surgical conditions,
Supposed to remember it.
60%
Just
ng
give you an
halaga ng case
idea.
rate ay napupunta sa bayad sa pasilidad at 40% naman ang para sa
That I
professional
don't
fee.
think is essential.
Ang kumpletong listahan ng case rates ay makikita sa www.philhealth.gov.ph. Paano ba ibinabawas ang case rate sa total bill ng isang pasyente? Halimbawa, kung ang isang pasyente ay na-confine dahil sa sakit na pneumonia 2 o high risk, na case rate o nakatalagang halaga na 32,000 pesos, ang 70% ng halaga ng case rate ay pupunta sa bayad ng ospital o halagang 22,400 pesos. Samantalang ang natitirang 30% naman ng case rate ay bayad sa kanyang doktor o halagang 9,600 pesos. Kung ang total bill ng pasyente ay umabot sa 40,000 pesos, ibabawas ang 32,000 pesos bilang PhilHealth benefit at ang natitirang halaga na lamang na 8,000 pesos ang babayaran ng miyembro sa ospital. Para naman sa mga senior citizens, ipinabawas ang case rate pagkatapos na may bawas ang kanilang senior citizen discount. Paalala ng PhilHealth, maging mapanuri at maingat sa pagpirma sa claim form sa pag-avail ng benepisyo. Lumagda lamang sa claim form 2 kung tugma ang final diagnosis na nakasaad sa Statement of Account o SOA o Billing Statement. Claim Form 2 Part 3, Certification of Consumption of Benefits at sa Consent to Access Patient Records. Huwag na huwag pipirma sa blankong claim forms para hindi magamit ang iyong membership sa posibleng health insurance fraud. Ang lahat ng benepisyo ay pare-pareho para sa lahat ng miyembro ng PhilHealth anuman ang membership category mo. Yan ang alagang PhilHealth. Para sa karagdagang impormasyon, maaaring makipag-ugnayan sa PhilHealth sa pamamagitan ng sumusunod na contact details at social media sites.
Thank you for that. I'm sure there's always room for improvement, Madam Chair. Yes.
So I was just commenting to Senator Senator Loren na pwede naman ipakita yan sa target market, di ba? For me, it's information for me. Tapos sabi niya, ay, ang bilis nung mga presyo. Sabi ko, well, hindi naman i-memorize yung presyo, it just gives them an idea. But who's the target market nga, di ba? Kung target market nyo is poor people, yung gusto lang na malaman na pwede pala, then maybe you can have your focal groups, no? Anyway, this not the
Focus group.
no, yeah, focus group. Exactly. So kunyari ang focus group mo is yung hindi nakapag-aral, yung ordinaryong mamamayan na hanggang barangay health center lang nakakapunta. Then sila yung gusto nyong maliwanag yan sa kanila. Tsaka ano yung capacity nila to absorb information? Good for 30 seconds lang. Tidbits of information. Type ba nila yung boses ng lalaki? Ganun yun, ha? O mas gusto na yung malaboses ni Senator Loren or Senator JB? Those are all, o pangit daw yung boses, sorry. Sabi ng staff ko. But anyway, that's just some feedback. But I mean, I think it's a step in the right direction. And you really just have to know who will digest that info. Because me, I like that info to explain to my staff. But I don't know if I've shared this story in public, but one of the beneficiaries of our programs is yung Tuloy Foundation, yung Don Bosco Prison. May center sila in Alabang, and they have like a few hundred children who live there. And the center of they are rescued children who are either abandoned, neglected, street children, abused, and their focal point revolves around sports, particularly football. So they redeem or they give these kids an interest in life again, because they can play football, have fun, and then they start concentrating in school and everything. But one of the stories that stuck with me is, and it's not a story, I met the kids. There were these 3 kids, magkakapatid, rescued from a gas station nearby. Rescued from a gas station, dinala sila doon. The youngest is duling. Ano ba yung duling sa English? Cross-eyed. And si Father Rocky said to him, papatingin kita sa doktor, ha, para gumaling ka. Tapos yung bata hindi ngumingiti. So finally, kinausap niya na lang yung kuya. Sabi niya, patitingin ko na yung kapatid mo. Tapos tahimik din si kuya. Tapos sabi niya, hindi ba kayo excited na mapapatingin namin yung mata? Alam niyo kung anong sagot? Hindi ho kami pwede pumunta sa doktor. Wala kaming pera. Can you imagine a child to even know and to believe that wala siyang access sa doktor because wala siyang pera? And you will not hear a middle-income child think of that. Ang middle-income child, ay, takot ako sa doktor. Hindi yung wala akong pera.
And that's half the population.
Or more than half.
So, yan ang take-off nyo. Ganyan na drama. Ganyan kasimple. May sakit ka ba? Ay, wala. No, ganun. Yung bata, wala akong pera. Papasok si PhilHealth na mascot. Ganito po. Ako po si PhilHealth. Hindi, ganun eh. Ako na Ganun. Yan storya mo. A real life, tatawa kayo. The real life story, wala akong pera. Tapos, ganun. Diba? Tapos, ako si PhilHealth. Tapos ano ang PhilHealth? Si PH. Oo. Ano yung PhilHealth? Tapos Filipino, Ilocano, iba-iba. PhilHealth. Libre ang patingin sa doktor, sa ospital, sa pinakamalapit na pampubliko na ospital. Pasok kayo, titignan kayo ng doktor at ng nurse. Anong gagawin kung may sakit? Libre ang pa-check up, yung gamot, operasyon, wag naman sana. Ganun kasimple. And then all of this, you don't take off. Wala akong pera. Pasok si PhilHealth. Then you explain. Ganun. Different markets, different publics, then you communicate. Because we want to use the funds. Di ba dapat gamitin ang inyong pondo para gamutin ang mga Pilipino? Ganun kasimple. Anyway, this is not a communications class. It's a health class, okay? Yeah. But serious, kindly submit to the committee how you're able to utilize your funds and communicate it just like that. You've others in your Facebook page.
Yes.
Yeah, submit. Then I'll ask questions from DOH after Senator Chagin.
No, I'm done with the PhilHealth.
Duly noted. Thank you very much, Madam Chair and this honorable committee. Duly noted on all your excellent suggestions. And we will comply po. We will submit on how we'll use the funds, no? Lastly, Madam Chair, I just want to add, with the permission of this committee, I just want to add that this year, PhilHealth has done PhilHealth caravans to the following countries, no? Cambodia, Singapore, Hong Kong, Malaysia, UAE, Lebanon, Indonesia, and a few other countries, no? So,
Is because our overseas Filipinos are covered by PhilHealth, right?
yes po. Yes po.
How many total are covered by PhilHealth?
The exact number po is if we can just be given a few seconds to pull out the number po. Guys, meron ba tayong ano? I don't have that number. Ano yun, sir?
Total registered
No, but
Caravan kayo sa lugar na yon, but wala po sa Apari, Cagayan, o sa Sibutu, o sa Bonggao, Tawi-Tawi, o sa San Remigio Antique, o sa San Fernando, Camarines Sur, o kung ganon. Tsaka hindi naman lahat kailangan physical presence. You can use...
Yeah. Madam Chair, to answer the question of the Honorable Senator Legarda, the total number of beneficiaries, OFW/migrant workers po, is 5.6 million. No po, this is the total of all the countries po, 5.6 million po. Aggregate po. Yeah, thank you po.
Yes, Senator Lord, I'm done with PhilHealth. Probably can go already with DOH. Yep.
Very basic question from DOH. There are different kinds of infrastructure, di ba, to help the provinces. Polyclinics, rural health units, you still call it that, or barangay health stations. Is it one and the same? One and the same, right? Okay, this is all under the Health Facilities Enhancement Program. Do we still call it that, HFAP, right? Okay. In my experience, there are those which are constructed, LGUs are given infrastructure of polyclinics or RHUs or BHS, then they don't have basic equipment or even the, not necessarily dialysis machines or ultrasound, etc., but even basic equipment, and they don't have the qualified personnel, medical healthcare personnel who can use it, or even the technologies to use it. How do you go about it? How do you decide which LGU will be the recipient of a project which includes the infrastructure and the equipment and trained personnel, whether technical or medical, doctors and nurses? And why is it that there are those which are set up with no equipment or with equipment but no doctors or nurses? How do we rationalize the utilization of funds for all these needs? Thank you.
Madam Chair, may we give an answer po? So the specific guidelines po for the availment of our HFAP projects is the first priority po is for the facilities that have already been completed, then we equip them so that they become functional right away. And then the second priority po is for those facilities that are already 70% complete and just need an additional fund to complete the infrastructure. and equipment po for functionality. Right now po, because of the consulta package of PhilHealth and the Universal Healthcare Law, we're also prioritizing already the construction of priority care facilities and their upgrading to be accredited by PhilHealth so that they can benefit from the consulta package reimbursement capitation from PhilHealth. With regards to the equipment po, the usual order po is to do the infrastructure before the equipment. If anything goes wrong in between that po, then the provinces can propose for the equipping of their facilities, and then the CHDs will prioritize and give it to the central office for funding po.
Obviously, ma'am, the equipment will come after the infrastructure. But why is it that there are infrastructure development, there's equipment, and oftentimes no personnel to man the equipment, or even though doctors or nurses assigned by DOH region? Example, Libertad, a small municipality in North Antique. It was, finally, there's a doctor. There's an infrastructure. There's an assigned doctor finally from the provincial health office, but no medical equipment yet. And they already sent a letter, actually, to my office. They have to go to a legislator to ask for equipment for the Libertad Polyclinic. And maybe another example, San Remigio Polyclinic sa Bundok in South Antique. There's the structure, but no staff and no medical equipment. Again, they have to request me for a budget for the equipment, and the provincial health office has to request a senator, a lawmaker, for augmentation, and they don't have the resources for that. So I want to understand, with the devolution of healthcare, where does the national government, the DOH, come in, and when does the assistance stop, if any, and when should the provinces come in? Because in the municipalities, they're waiting from the provincial health, they're waiting from DOH region and from central, and when no movement or no augmentation has come, then they go to the senator, the lawmaker. So I would know this because it's my home province. What about other LGUs which have built structures but no equipment, or equipment with no personnel who's competent enough to man it? Equipment, but with someone manning it, but perhaps no doctor or nurse to oversee the utilization, the wise utilization of the equipment. So all of this, ma'am, how do you rationalize all this? Thank you.
Yes, Madam Chair, Senator Legarda. So infrastructure comes first, and then the equipment. So the Health Facilities Enhancement Program is willing to provide for all the infrastructure and equipment requirements for our health infrastructure in the country. But because of the limited funds we have had to enforce prioritization criteria. And usually this will be local government units that are less capable of doing it. So like for major cities that can do it, then they can already do the equipment. For the health worker, Senator, and Madam Chair, there's a MOA before we make the health facility enhancement project in the area that the local government unit has to commit for the HR hiring and maintenance also of the operating expenses of the LGU. But in cases where the local government unit is not able to provide some of the health workers, then we have a support system for this, which is the National Health Workforce Support System, where we can deploy nurses and midwives to the poorer LGUs in our country.
So the LGUs, once they're a beneficiary of, let's say, a polyclinic from national government funds, kasi hindi naman nila kaya magtayo, no? Usually, they must deploy their own health workers. Yun ang unang line. Dapat sila. Pero again, walang trained sa kanila. Mahirap
Can I
na.
interject?
Ano yun?
Diba, Isek Vergere, ang pagkaalala ko nun, ang plano natin is yung poorest of the poor LGUs tutulungan ng national. Yun ang intindi ko. So yung naman medyo may kaya naman, syempre we push them, and you need to integrate this with our Doktor para sa Bayan Act, which is not just doktor, although the law is doktor, where we're strengthening also the allied health professions, no, na kung sa lugar nila talagang nang niwala man lang nursing school, niwala man lang alam mo nang mahihirapan yan, alam mo na. So we really have to integrate all of that, and I think that's work in progress, no? Medyo there's work to be done. Pero sana ma-plot na natin yan para we really know na dito butas na butas, because I'll just put it out there na yung utilization ng ating doktor para sa bayan is on the low end. But this is really a CHED issue pala, no? This is not UH, but so that you know. That is for my next hearing, yung sa CHED, no, that mababa ang utilization nila supposedly during COVID, konti lang yung nag-apply to be doctors. I get it naman, pakahirap naman mag-aral ng medicine tapos online. So baka you can also look into it on your part, no, with sa mga hospitals nyo na marami naman nagdo-doktor, anak din ng doktor, di ba? Marami din naman nurse, pangarap yung anak nila maging doktor. So baka you can also check what's going on, kasi these are med schools in the provinces. So I'm just saying you have to tie that all in.
Which brings me to the question, may I request, Madam Chair, from the DOH, I'm only referring to 2 LGUs, which are not yet cities, of course, and they're not very poor, but third, fourth, fifth class municipalities. May structure, polyclinic, sayang, walang equipment, walang trained personnel. They have to seek the assistance of a lawmaker to be able to equip that. If that happens in my home province of Antique, what more other provinces? Mabuti na lang meron silang senador na galing Antique, and I will surely provide and make it an amendment. So my question is, why does it have to be an amendment of a senator, of a lawmaker? Can it not be part of your organic budget, your NEP, so that all LGUs with finished structures, whatever they're called, polyclinic, ano matawag dyan, super health center, BHS, barangay health station, and rural health unit, iba pareho lang yun. Dalawang yun, ano man ang tawag natin dun, tapos dapat yung infrastructure at merong equipment, ano man ang bagay sa equipment na yun. Hindi naman lahat kailangan may x-ray machine, because I don't think a barangay health center needs it. Just need the basic BP, oxygen, sugar, diba? Ganun. Tama? Testing. So, why don't we have, as a chair mentioned, a mapping of all completed infrastructure? Sayang kung hindi nyo lagyan po ng gamit na suitable doon. And help them scout or even train the healthcare workers within their jurisdictions, at kung wala, dun papasok na ang national government, because sayang yung tinayo kung walang equipment. Sayang yung may na-train, hindi na-deploy, hindi alam merong palang kailangan. Can we please have that? Unless you have it now, but it would take so we have a picture of the whole country. Among the 80 provinces, ano ang mga natayuan na hindi naman ginagamit dahil sa kakulangan ng 3 bagay na binanggit ko. So infrastructure, equipment, and trained personnel, whether medical professionals. Oo. If you could submit that to us, and I don't need the data because there's nothing much I could do about it, and your recommendations, not recommendation, what you're doing to address that. Because sayang, pinagastusan ng pera, ng budget, ang pagtayo at binilan ng equipment, nakatiwangwang kasi walang marunong magpaandar. Diba? May mga ganun eh. Sayang po. Who's in charge of all this? Kayo po sa Health Systems Development Team? Is it Dr. David?
Yes, Madam Chair, Senator Legarda, we have an office in charge of this, the Health Facility Enhancement Program under ASEC curriculum.
Because, sino po? ASEC Gorgolon, yes. Could you kindly submit that to us, and your HFEP requests or your NEP? Then I'm sure you have a request for augmentation, no? Will it cover and complete the HFEP programs or hindi pa rin? kulang pa rin. Oo. Kaya gusto natin sanang makompleto po. At huwag magtayo na hindi kompleto. Should not that be a rule? Huwag magtayo kung di naman kasama yung equipment required. Right? May mga nagtatayo na wala pong gamit sa loob.
Can you explain the process? Kasi di naman siguro tayo kailangan executive session, but the truth is, syempre, may mga nagre-request, di ba? So how do you now counterpart that request to ensure na you have the corresponding equipment? And kasi di ba remember before you showed me there's a list. There's equipment, there's a infra, yung status ng iba-iba, like they have plotted where there are infras na wala pang equipment or kailangan dagdagan yung equipment, pero hindi ko alam how you tie in the personnel, the health personnel there. So can you reply with that in mind?
Thank you, Dr. Ruggiere. Because of my request to you, nagpadala siya under the Doctor to the Barrio program ng doktor sa Libertad. Eh kung di ako nag-intervene, kung hindi niya alam, sinong may alam? Sino sa inyo ang may alam lahat ng sitwasyon sa buong bansa? Sayang naman.
Yes, Madam Chair, Senator Legarda. So after the infrastructure, we usually do the equipment, and then for the health workers, the LGU.
To be clear, no,
has to
para
deploy.
maliwanag kay Senator Ligarda, ang statement niya is, after the infrastructure, we do the equipment. They don't do it on the same year kasi pag
Yes.
dineliver si equipment, wala pa si infra.
Yes.
So kaya nga talagang may list kayo kasi kung natayo si infra as scheduled, then the following year si equipment. Tama?
Yeah.
Okay, sige.
Yes.
Para maliwanag.
Yes, and we can also submit the mapping and the list for our health facilities enhancement program. But maybe, Madam Chair, Senator Legarda, for the specific areas you mentioned, maybe we'll need to visit the area and assess what happened there. We have our regional directors for each region who can do that for us.
Do you have the information in your computers that you can submit after the hearing of all built health centers, regardless of name and kind and size, with equipment, or those without equipment na dapat nyong i-furnish ng equipment and trained personnel and a doctor and a nurse?
Yes,
And so
Madam
that
Chair.
in your priority in the utilization of the 2024 budget under HFEP, you would know what to fill up first, right? Kasi
Yes,
tayo
we
na
can.
tayo, parang walang planning. Tayo ng tayo, tapos yan, may structure, walang equipment, walang tao, walang nurse,
Yes, Madam Chair, Senator Legarda. So we do have the Philippine Health Facility Development Plan, which maps out which areas have which facilities and which need more assistance. But of course, the theory from what actually happens is because of the lack of funds po, and of course, various requests that have to be filled. But anyway po, we can submit that data.
Dr. Ruggiere, sorry, Madam Chair. Lack of funds. Pero mababo po utilization nyo, may pera po eh. Let's say, to date, if I'm not mistaken, correct my figures, please, your finance. 43% pa lang po, we're already on our last quarter, ang inyong obligation pa lang ng funds. And 66% of this has been disbursed. Is this correct? 66% of the 43% of the DOH budget, or 105 billion, has been obligated, and 69 billion of the 105. But this is for the whole DOH budget, not just HFEP. I hope I am given the correct. So kung 43% lang po ang inyong utilization by September of 2023, then we say we're not able to provide equipment to polyclinics or health centers, etc., because of lack of funds, but you're given funds and you're not spending it, at least in due time. Ma'am.
Yes, Madam Chair, Senator Legarda. At least po, in the case of the Health Facilities Enhancement Project, once you have post-NEP appropriations, they do not have the advantage of advanced procurement. So we have to wait for the release of the SARO in the year wherein it's supposed to be allocated. So the procurement usually becomes late, and then it's really a big project. Once it's been obligated, there's also the perspective of progressive billing. So that lessens po yung disbursement rate because the progressive billing will be upon completion of various tranches po of the project.
Mabagal. No, because necessarily, clearly, DOH, you're populated by doctors. You take, pero you're not builders naman eh. Nag-MOA kayo with LGU? Is it a MOA with the local government or MOA with DPWH? It's local government, right? Yes. Just for the HFEP, yes. But your low utilization, 43% as of September. Is that accurate? Maybe you can explain po, what is the cause of the low utilization of your funds, of your budget? How can you speed up the utilization? And this is not the first time, not to blame anyone. It's a perennial issue of DOH. Sayang ang pera.
Madam Chair, Senator Loren, good afternoon po. In terms of utilization of budget, we have several big ticket items within the budget of the department. And part of that would be the Health Facilities Enhancement Program. And as has been explained by Yusek Beth David a while ago, it takes time for us to be able to fully disburse the fund because of these are big constructions, and we wait until the completion of the project until we can fully disburse. The same goes with our commodities which we procure, which is about 20% or 25% of our overall budget would be the procurement of our medicines, our vaccines. And before they can be fully disbursed also, we have to wait for the full deliveries or the completed deliveries of these items. So usually if you look at the trend of budget of the department and the utilization, there would be this trend wherein you would see that towards the end of the year, that is where we really have higher utilization and because of the completed deliveries of the procurements, Madam Chair. And one thing more, Madam Chair and Senator Loren, in terms of deployment of health human resources, it's really the counterpart of local governments. It's the national government through the Department of Health, which provides the infrastructure and the equipments. But in terms of health human resources, it's the counterpart of local governments. And it is stated in the memorandum of agreement with them every time that we have these infrastructure projects with them. But as we have said, we augment, as what you have said. We prioritize those areas with need, with no access to health human resources, and then we deploy our doctors to the barrios, our nurses, our medtechs. Sometimes, kaya po minsan, even in the middle of the year, we can still accommodate some requests. Meron pong mga nagpapalipat, meron pong hindi mga nakukuha dun sa local governments for some reason or another, kaya nakakapag-urong-urong pa ho kami. But definitely, at the start of the year or maybe dun ho sa cycle namin, nakakapag-identify na kami ng mga GIDA areas or those far-flung areas where there are no healthcare workers that we need to augment or supplement po.
Liwanag po. The infrastructure is national government. Equipment is national government. The healthcare professionals, whether technologists or doctors and nurses, would be local governments. But many of them don't even have medical schools or nursing schools in that area. That's when the national government will augment through the Doctor to the Barrio program.
Madam Chair and Senator Loren, yes, doesn't necessarily have to have the medical schools. That's the production side. But there are standards, for example, for a primary healthcare facility like the RHUs. Kailangan po may isang doktor, may isang nurse, may ilang midwives. So kailangan po yun mapunuan lahat ng local governments para po mabuo po yung kanyang primary healthcare facility. Tutulong lang po ang national government through DOH base po dun sa assessed na need ng isang locality. Like GIDA po siya, mababa po yung kanyang access para dito sa ganitong mga healthcare workers doon po. Yun po yung criteria natin for us to be able to deploy doctors, nurses, and the other healthcare workers.
The PS should come from the LGU. So it's really difficult. Sometimes they ask for help, national builds, and then kulang yung pondo, so bitin ang equipment. So next year, okay, equipment, kung walang magbibigay na senator o wala na yung senator, wala na yung congressman na build yung structure, wala yung equipment. Tapos wala naman trained personnel na magman ng clinic, polyclinic, or RHU. Yun ang mga... So perhaps the mapping of what's missing somewhere, right? You could give that to us, and I'm sure the HFEP in charge, Madam Asek, yes, will fill in the blanks based on the available funds for the HFEP. I understand, of course, a utilization of fund mas mabilis sa second and third quarter. I stand corrected. What I told you, 43% is as of June 30, but that's still low. But please assure us you will use your funds in the last quarter. I just wanted to make sure our cash budgeting may not be applicable really to DOH. Kasi kung 1 year lang to, Madam Chair, imposible. So talagang palaging extended yan hanggang sa next year, no? Cash budgeting, imposible for actually DepEd, DOH. Hindi talaga kaya. Unless you can obligate it everything by December. Can you utilize that?
Yes, Madam Chair and Senator Loren, just for these past years, the DBM has already issued the circular advisory that the budget is valid for 2 years already. And also what we do now is doing early procurement activities where even during the last quarter of the year prior, we start our procurement already so that we can easily obligate and disburse by the end of the year.
The payment to our health personnel, is it on time? Because there was kailan to? Just recently, September 23, hindi ba? There were regional health offices, regional branches of DOH. The United Private Hospital Unions filed a complaint in the ARTA, Anti-Red Tape Authority, against regional branches of DOH because of delayed emergency allowances of healthcare professionals. Why should there be a delay when the funds are available?
Yes, Madam Madam Chair and Senator Loren, would this be the health emergency allowance which was given during the time of COVID? Madam Chair and Senator Loren, if we can ask Yusek Carol Taino to answer the question.
Yeah. Good afternoon, Madam Chair, Senator Loren. So, the total requirement for health emergency allowance for 2021 to 2023 amounts to 113 billion. And out of this, the DBM released in 2022, 46.8 billion or 41% of the requirement. So we have arrears leaving to 66.2. But out of this 46.8 billion, we were able to release 46.7 billion or 99%. These were obligated, downloaded to the different CHDs as well as different health facilities. And out of this, 42.7 billion or 91.42% were already disbursed. Yes, we were able to pay 6.5 million healthcare workers po.
The COVID time, no? Kasi health
Yes.
emergency allowance.
2020.
Kung 2 taon, bago tayo magbayad, naintindihan naman natin pag naka-lockdown tayo, pero hanggang 2022, tapos buong 2023, bakit natin iintayin pa na mag-complain at mag-file ng mga complaint ang ating health workers na hirap na, every peso counts, na mag-file ng complaint sa regional offices ng DOH bago natin bayaran. Is it, wala pa sa inyo yung pera? Hindi binigay ng DBM?
Kulang po yung na-release sa atin na cash as well as the allotment.
Pero pinangako natin sa kanila yun, di ba?
Yes.
Ba't tayo mangangako na hindi natin kayang ibigay?
May
Dr.
batas,
Federe,
ma'am.
kayo po nung COVID, 2021 to
2021
hanggang
to
2023. Pinangako natin yung health emergency allowance. Anong sabi natin? Magtrabaho kayo, bibigyan namin kayong extra allowance. Kada buwan, di ba? Kada buwan, naging 2 taon, tapos kailangan silang umangal sa regional offices bago natin bayaran. Parang mas maugali na nangako, hindi kayo tayo sa gobyerno, huwag tayong mangangako hindi natin kayang tuparin.
Yes, Madam Chair and Senator Loren, we had been appealing to the Department of Budget and Management since 2021 for the additional budget so that we can...
Sino bang nangako niyan para
Nasa
maliwanag?
batas po siya.
Bayanihan.
Opo, sa bayanihan po. Yes, Senator and Madam Chair and Senator Loren.
To. And it's addressed to us lawmakers. Huwag tayo mangangako sa batas kung walang source of funds. Let us not give the people bubbles or fake hopes na hindi kayang tuparin. Kasi umaasa ang mga tao. Pero buti ngayon, sabi nyo, 91% nabigay na po. Okay. So para maliwanag, kasi kayo ang face ng COVID eh. Hindi kayo na COVID, no? Pero ibig sabihin, nung panahon ng COVID, kayo ang palaging humaharap. At kayo nagsasabi, humihimok sa mga health workers, tumulong ako yung sige na. Tapos naglabas sa magandang batas, bayanihan. Tapos nag-aantay sila. Siyempre, bawat extra. Oo, naghirap sila eh. Namatayan eh, nagkasakit eh. Tapos 2 years later ang bayad para lang maliwanag. Kasalanan din ng lahat. Kailangan tayo wag gagawa ng batas na walang funding source. Okay, continue po. So 91, bayaran nating lahat. Kaya naman po babayaran. Hanggang end of the year, kaya po niyong bayaran. 91% na eh. Oh.
Program yan, di ba?
Yes, Madam Chair, Senator Lauren, we have a unprogrammed fund of 52 billion. Pero we have already requested 26 billion out of the 52 because that's the requirement we receive from the different facilities. Only 26 billion. But up until now, we haven't received any
What's the 26 billion for?
arrears for the health facilities po.
To be clear lang, no, before you continue answering, so the Senate included it, but due to budgetary constraints, some of it was in program, some was in unprogram. So I think yung nire-request nyo for release is still in the unprogram.
Yes, ma'am. Yes.
For the health facilities or for the health
Yeah.
emergency?
allowance.
For the HEA.
Yeah, yes, ma'am.
Madam Chair and Senator Loren, just to be clear, the total funding requirements for this health emergency allowance for all of from year 2021 until today for all of the healthcare workers eligible is 113 billion. We were only provided by DBM from 2022 until this year a total of 46.8 billion. So we still need roughly 66.2 billion in order for us to fulfill our obligations to our healthcare workers.
To Senator JV or to the chair? Thank you.
Thank you, Arsen, President Pro Tem. Probably I can ask any concerns in Laura, yung mga infrastructure, HFEP. Probably we can have an update lang po doon sa mga specialty centers since the law was passed recently, and it was also a priority program of the president. And we increased even the budget last year, no? Nag-add tayo ng 2 billion here in the Senate. So probably can we have an update on the status of the different specialty centers?
Yes. Madam Chair, may we request that ASEC Gorgolon be recognized to give the update to Senator Hercito? Thank you.
Good afternoon, Your Honor and Madam Chair. As to the status of specialty center with the SONA directive in 2023 this year, we were able to get an approve from the appeal, which is Your Honor was able to push for it an amount of 2.4 million for 10 hospitals. But currently, from the proposed budget of 2024, we have attributed around 6 billion from our 83 hospitals with regards funding for specialty centers. But I would like to emphasize that out of the 6.4 billion that is part of the NEP for 2024, we still need an additional 3 billion for our specialty centers for us to continue the funding for our heart, lung, kidney, and cancer for these 10 hospitals, 1 billion. Another 1 billion for the expansion of additional 3 hospitals to cover the 17 regions, because right now we have 10, and additional another 1 billion for other specialty centers. So we are asking for 3 billion for this to cover the promise that we need to have across the country specialty centers, particularly for heart, lung, kidney, and but we will be submitting to you the specific amount for this, Your Honor. Thank you very much.
So doon po sa total yung 10 that we have on the list, no, yung Mariano Marcos, Baguio General up to SPMC. These are still the same hospitals that were identified?
Yes, Your Honor.
Or will we add some
We still
other
have-
facilities?
That's why we are proposing for 2024 additional 3 billion for this, because 1 billion will go to this 10 hospital as continuing funding and additional expansion for another 3 hospitals, plus the proposed specialty centers for brain and spine, another 1 billion. So this will only cover for 1 year, which is 2024. But we need to complete all of this in the next 3 years po. Thank you very much.
Yung pong the budget that we added last year, I just want to check, just want to know how was it utilized kung
We have
to
already
this year, para lang malaman natin, because alam niyo naman dito sa Congress and Senate, we are very much particular in the utilization, no? We always give, but we would like to know also if it was really put into good use. Last year, we gave to the kung ano yung wish list. I can remember si Yusek Varhere at that time, magkano ba yung ideal, and I think the Senate gave additional 2.4 billion. So siguro po, you can continue.
Yes, sir. Actually, the following updates on the approved 2.2 billion for 2023, particularly for Baguio General Hospital. We have the construction of new bunker for the cancer center. So it's already ongoing procurement and about to be notice to proceed will be issued po. And then for the Batangas Medical Center, it's pre-procurement on September 5 and pre-bid conference September 19, and we are it's scheduled for bid opening on October 3. This is for the construction of heart center. And then for Bicol Medical Center, it's really for the construction of cancer center, which is for our nuclear medicine. So this will be the target date of notice of award is September 29. That will be tomorrow, sir. And then for Bicol Regional Hospital, awaiting delivery of equipment and ongoing procurement for the rest of the equipment, because they are targeting to procure equipment for lung. For Western Visayas Medical Center, the 100 million is for the infra construction of cancer center. So they are under the pre-procurement last September 18 and scheduled for opening of bid on October first week po. So 90 million ongoing procurement and for preparation of NOAA, an NTP on contract.
Can you repeat po yung sa Western Visayas? Because I just came from there and visited it. Tapos na po yung infra, no? I think it's ready already.
Equipped na po
Very
siya.
soon. Ano po na-equip? For lung, kidney, and heart din po ito, no?
And Heart and Lung Center, and the amount of 265 million po for the approved 2.2 for this.
265 million, yes.
Yes po. And then for Vicente Soto, we have the ongoing, the sign and build for renal specialty center. So on process pa po yung procurement. And for Eastern Visayas, it's construction on equipping of heart, renal, and lung in the amount of 248 million. So about to be awarded for the equipment po. And it's basically equipment for cancer center and renal po. And for Northern Mindanao, it's only 65 million. It's equipping for heart center. So awarded na po, scheduled for delivery. And for Southern Philippines, it's 185 million. It's delivery and installation of an equipment by November 2023. So this is the update of this 2.2 billion, which is approved by your August body this year po. Thank you very much.
That's good news. No? Madam Chair, also I had the chance to visit some, and was reported also that some of these are already able to perform open heart surgery, like in Northern Mindanao Medical Center, saan pa nga ba, SPMC, Vicente Soto, am I correct, no? They are already able to perform?
Yes, sir. Oo. Or we can also ask Dr. Abadilla to really, thank you very much. If Your Honor,
Dr. Abanilla, can you update us?
Good to report that a lot of these specialty centers are already functional. We have the 5 that are considered as advanced. That is the Southern Philippines in Davao, the Vicente Soto, the Northern Mindanao, the Baguio Gen, and the Mariano Marcos. The rest have basic facilities with cath lab capable, a total of 13 centers now that are functional and capable of doing surgical procedures. The problem, as was touched kanina, is that some are not yet covered by ZVEN sa PhilHealth because they have not met yet the requirements of doing the number to show their competence. But we are helping them achieve that. That's why we have the surgical mission ongoing. And as mentioned by Director Gorgulon, Sec Gorgulon, there are only like 4 more regions that are to be developed. That those are the Caraga, the Cagayan Valley, the Zamboanga. Yeah.
Well, that's good news, because I'm able to go around because I ride motorcycle that I try to visit some of these health facilities, and I can see that some are yung infrastructure are already ready. Yun nga, yung equipping na lang. Tanong ko lang po yung, like for example, Cagayan Valley, kasi po malayo yung yung specialty centers dito.
Yeah.
What will we use there? Is it the SIMC or Cagayan Valley, yung sa Cagayan mismo, or yung Southern Isabela Medical Center? Because ito medyo malaki infra nito eh.
I think Cagayan Valley Medical Center has been identified.
It was identified,
Yeah.
but is the infrastructure ready? Parang mas malaki yung SIMC will also be utilized, I think, for a specialty center. I don't know for what. Kasi sayang yun eh, medyo malaki yun.
Well, if they are really bent on developing one, like in Bicol, this is the only region with 2 heart institute, one in Naga and the other in Legazpi. No, because the people in Naga are not comfortable with only one heart institute at Legazpi. So they made efforts.
So we want to know also so that the Senate can introduce amendments in case for Cagayan Valley, kasi parang napunta ko yun, it's not so big. Baka kailangan yan infrastructure to support these specialty centers that will be put up.
Once identified, we do this hand in hand with DOH. Of course, DOH provides the infrastructure in the facility.
Yes.
And we help in the manpower complement. So,
thank you po, Doc. Siguro,
Kasi same topic, no? But obviously, Dr. Joel, you are reporting on heart in particular.
Heart center,
Oh, yun
yeah.
na nga. So, ganito na lang gawin natin. I have a list kasi of the existing hospitals that have specialized functions. Thank you very much, Senator Lauren. So, but what I want sana, sino ba point person natin sa specialized? Of course, we go back to DOH, tama ba? Kasi yun nga, kasi nung nagsasalita kayo, sabi ko, teka, heart lang ang ano nyo, right? Unless you appointed somebody among yourselves to be the overall. Kasi what I want to be able to see is what is the plan in the next 5 to 10 years, di ba? You can
Yeah.
only speak for heart, di ba? So sino ba point man natin dito? DOH. Sino? Good music siya. Do you mind, Senator JV? Let's just tell her, just give us an overview. But I also want to know the target. Kasi like Senator JV said, tell us. Kasi gusto namin tumulong. Kung funding yung problem, kami makakatulong. Kung health specialist ang problem, we cannot directly help. We will go back to you and say, okay, what is the problem? Diba? Paano? Sige, just very briefly lang. And maybe I think actually that's a visual and a report that we need to see.
Good afternoon, Pam. Good afternoon, Madam Chair. Good afternoon, Senator JV. Senator JV, we have the functional specialty centers. We have a total of 113 functional specialty centers, which comprises of the following specialty cares: brain and spine care, burn care, cancer care, cardiovascular care, dermatology, eye care, ENT, geriatric care, infectious disease and tropical medicine, lung care, mental health, neonatal care, orthopedic care, physical rehabilitation medicine, renal care and transplant, toxicology, and trauma care. So we have an existing, a total of 113 functional specialty centers.
12. Those are 12 specialties that you mentioned.
17 based on,
Okay.
17 based on my
Bilang po.
count po,
Okay, so
Madam
17.
Chair.
So then you'll have to break it down for us, di ba? Like, ilan yung neonatal, ilan yung trauma, ilan, di ba?
For
Okay,
me,
huwag mo nang banggitin isa-isa. Just give us the report.
we will
That's the
submit.
report,
Madam Chair.
and then that's the existing. O ano yung plan? Oh, yun. Baka you can, if there's a way you can give us a copy now so that I can digest it. Of course, I can contact you anytime, but we can put on record where we are para we know what are, and did you, what's the budget, what's the budgetary, current provisions we have to further that, the specialty care? What's the budgetary, can I see? Sige. Anyway, go, I'll let Senator JV proceed because I want to see what that budget is and how much can you do with that budget. Precisely, we passed the law kasi that's the tipid version, di ba? Let's use the existing infrastructure, obviously. And not tipid, it's the smart way of doing it kasi nandun na yun naman yung mga doktor. Pero we want to enhance it. Todo-todo na natin yung support na ibibigay natin para they can practice and provide the services needed. Okay? Sige, JV, go ahead.
And also probably anybody can answer. Bawa yung update na sa HFET, no? Because in the past 5-6 years, a lot of our facilities have improved a lot. Pero nangyayari minsan na we were able to fund the infra kaya lang hindi na isunod yung PS, personal services and equipment. So like for example in Bohol, no, malaki po yung nailagay natin doon sa Gallares Memorial Hospital. It's a big facility. I can remember during my first time I remember kung a billion or something. Medyo malaki yun, but the problem is it was hindi naisabay yung personnel and equipment. So like for this facility, what's the status so that we can help? If we can add pang PS, pang equipment, kasi sayang nandun na yung infra. Ganun naman talaga yan. We have to, kailangan mauna talaga yung infra, no? As mentioned by Yusek Berhere. But yung status siguro of these facilities.
Madam Chair, Your Honor, actually there are two facilities in Bohol. The Tagbilaran facility, which is the Gallares main.
So
And then there
medyo
is the
malaki na
Cortes.
ilagay natin doon
Yeah, and then there is the Cortes Multi-Specialty Center, which is the construction is ongoing, so it's around 2.5 billion. But there's already an approved NOSCA for this facility, and they're now starting to hire. So hopefully this facility will be functional and the completion of this infrastructure will be the first quarter of next year. And then equipping is also side by side installation for next year. And hopefully on the second or third quarter next year, it will be functional as level 1 hospital. But it's ongoing construction. It's ongoing construction, Your Honor. Thank you very much.
Well, that's good to hear. At least it's all moving. We have improved a lot in terms of the health facilities, no? Well, Madam Chair, kasi I have yung advantage because I ride a lot. I get to see even the far-flung areas sa pupuntahan ko, no? Siguro I just like to give attention dun sa mga far-flung areas that really need to be assist or improve. If take note na lang po, and probably during the main budget deliberations, give us an update, no? Yung mga Kalinga, Nueva Vizcaya, ano pa ba? Kalinga, Ifugao. These areas kasi are rarely visited by national officials because of the distance. So, they are, napuntahan ko po yun, Madam Chair, talagang kawawa rin yung facilities nila ron. So, it really needs improvement. But yung Kalinga, nalagyan natin before ng para 60 million for new buildings. So, the others siguro, just give us an update at least so that we can augment if necessary all of these facilities, especially in these GIDA areas, no, yung mga malalayo talaga. Can we have an update with that?
Yes, Madam Chair, Your Honor. Thank you very much. Noted on that.
Okay, that's good to hear. We probably, Madam Chair, will have an update again, once again. Para po yung kailangan yung 3 billion, yung
Sir,
again for specialty centers that you are requesting for
Madam
the
Chair,
next budget
Your
season.
Honor, the 3 billion is only for specialty centers, but we are also requesting additional 1 billion for our primary care facilities and LGU hospitals.
So that's total for 4B.
4 billion.
Yung 1B po for LGU hospitals.
LGU hospitals and primary care facilities.
So we can augment and help like
Yes.
provincial hospitals.
Yes, Madam
Natutulungan naman
Chair,
natin,
Your
no?
Honor. Yes.
Yeah, take note also siguro yung mga napuntahan ko, no? Tarlac Provincial Hospital has very nice facilities. Dalawa yun, napaayos din. It's nice kasi because if the provincial government prioritizes healthcare, nakakatuwa, no? So I think if we can look at that and see what equipment we can give them, ready na po yun. Nakita ko maganda. Sa Bataan, sa PJ Garcia, which we improved through the HFEP, is already quite big. The infrastructure is there. Siguro, equipping na lang and personnel. If needed, probably you can update us the status and what needs to be done para lang hindi masayang kasi nandun na yung infra. Okay, Tarlac, what else? Yun yung mga napuntahan natin, no? Basilan also, one time I was able to go. May nakatiwang doon, Madam Chair, na hospital that was started pero parang it was not completed, no? Na humingi ng tulong si Governor Mujib Hataman kasi sayang, no? Basilan. If we can help, kasi ito yung malalayong areas, they have to go cross to Zamboanga. If we can do that, at least hindi na magka-cross yung mga taga-Basilan. Okay? Siguro yung na lang po, last point, Madam Chair, doon po sa NICA, sa National Integrated Cancer Control Act, which we passed also during the 17th Congress. It's good to know that at least it was already implemented fully. Mas na-implement na po siya, no? Before in 2020, napakababa. Yung cancer control program natin has a measly 184 million. We know for a fact that it's very expensive to treat cancer. But now it was increased gradually. Last year was 1.057 billion and it will be 1.24 billion this year. Cancer Assistance Fund was increased also from 500 million. 2023, it will be 1 billion for 2024 in the Philippine Cancer. So ano pong natin dito, updates and the plans probably on a nutshell siguro. Yusek Barrera? Or
Yes, Madam
not-
Chair, and Senator Ejercito, the updates for our cancer control program would be, first, the joint memo circular for us to be able to implement the Cancer Assistance Fund for 2023 was just recently signed, and it's going to be implemented already. Our utilization of our Cancer Assistance Fund for the year 2022 is around 83%. It would still, we are still completing our documents so that we can get a higher form of report for utilization. In terms of the cancer medicines, Mr. Chair, Madam Chair and Senator Ejercito, we have right now 31 cancer access sites where our patients can get their funds or their medicines. We have plans of expanding the cancer sites to 34 access sites by next year. And our budget for the NEP that has been provided to us would be around 1.02 billion. But Madam Chair and Senator Ejercito, we are still appealing for an additional 1 billion for the Cancer Assistance Fund to cover further additional beneficiaries, especially for the early detection and prevention of cancer, Madam Chair and Senator Ejercito, ma'am.
JV, just to ano lang on this, because I had a discussion with Secretary Ted, no, well, of course, pre-CA, and he was saying that precisely he wants to strengthen their detection and treatment screening programs para like any process in the healthcare system, dun tayo sa prevention, dun tayo sa early detection, dun tayo magbubuhos ng pera. So happy naman ako doon, no? And if we can augment, we'll do that.
And that's the good news, Madam Chair, that at least nag-roll na yung NICA finally, no? And I heard also in the reports that a lot of our specialty centers and health facilities are kasama na rin po yung cancer centers. No? So that's good news. And we'd like to thank also our Chairman Committee on Health. Yung specialty centers are already moving, no, as ma-reported, yung binigdag natin 2 billion, at least it's being utilized very well. Last point na lang po, may kasi yung po sa HPV vaccination, do we still do that? Yung pong for cervical cancer, because it's the second most prevalent cancer among Filipino women.
Madam Chair and Senator Ejercito, yes po, we implement the human papilloma virus immunization among our grade 4 students. The criteria would be 9 years old to 14 years old children. Meron ho tayong pinapatupad, kaya lang po ngayon nanghihingi din po kami ng additional na nag-a-appeal kami for additional budget because currently our implementation only includes 15 regions. So wala pa ho tayong nako-cover sa Region 2 at saka sa Region 4B. So ito pong dalawang regions na to, if we can be given the additional 400 plus million for us to cover the entire nation among our grade 4 students, Madam Chair and Senator Ejercito.
Hey, thank you, Madam Chair. Yes.
On that note, how's the take-up of that vaccine? Because like the infant vaccination, I know DOH is working double time, no? And medyo nag-improve, pero below ano pa rin ba tayo? Can we just get a quick report on that?
Yes, Madam Chair, we will be providing you with a completed report. But as with the other antigens, bumaba po yung uptake, especially during these past 2 years because of the pandemic.
I mean, even towards the latter part of the pandemic, you already had a program, di ba? I know, kasi rolled out kami todo-todo sa Taguig. So, given that, masasabi ba natin na nag-i-increase na yung uptake? Siyempre, hindi mo naman mapipilit, pero with the efforts being made by DOH and the LGUs, has it improved?
Yes, Madam Chair. First po, we have a 27% coverage for first dose. And
But you're talking about HPV.
yes po, ma'am.
Okay.
And for the second dose, it's much lower at 9%. What we are doing right now is partnering with the Department of Education.
HPV, tatlo, di ba?
Dalawang doses.
Dalawa lang ba yan? Ano ba yung inisip kong tatlo?
Opo.
Baka nasobrahan ako.
Dati po kasi ganon.
Oh, yun.
Yes.
So, tama memory ko. Okay, okay.
So ngayon po,
Nag-innovate na, dalawa na lang.
yes po. So actually, ngayon po, meron na rin lumalabas na studies na pwedeng isang dose. But anyway, we will be recommending at the proper time with enough evidence. But right
So
now,
siguro ano rin, similar to the input of Senator Loren dun sa sa PhilHealth, 'di ba? Yung simpleng mga info materials na parang ay pag isa lang yung dose mo nakukulang, 'di ba? If particularly for those that really require a second dose, no?
yes, Madam Chair. Actually, we're partnering with the Department of Education also because we're looking at ways on how we can improve the uptake of this vaccine among grade 4 students. Baka pwede mga
Even
requirements.
with those students, I remember, I'm sure all of you will remember when you were kids, you would go home to your parents, magsusumbong kayo kung may, kunyari sinabing bawal man nagarilyo, natutunan mo yun, tapos pupunta, ay daddy, hindi naninigarilyo daddy ko pero yung ganun ba na, ba't ka naninigarilyo? Sabi sa school, masama yan. Di ba ganun? So if you go through with DepEd on this vaccination, sila din magsasabi sa parents. So ano lang, reminder for the coordinations.
Madam Chair, lastly, I just like to make mention that we have this massive campaign for HPV vaccination among grade 4 in April, this coming April po.
So submit na rin nung uptake ng vaccinations in general, particularly sa infants. Okay. Okay? You mentioned to your last question. So we'll give the floor to Senator Bongo, who's the chairman of the Committee on Health. Yeah?
Just a short manifestation po. Salamat, Madam Chair. Always naman po akong full support sa ating health, no? Kung ano pa pong makakadagdag, makakatulong. At ako po nalulungkot nga nung nabalitaan ko, nabawasan naman ng pondo. Magtutulungan lang po kami dito ni Senator Pia, ating finance, Senator Angara, Senator JV. Pareho naman po ang aming parating pinaglalaban. As Chairperson of the Committee on Health, I want to emphasize the importance of 2024 budget of the Department of Health in our path towards recovery. Ilang beses ko na rin pong sinabi, now it's the time to invest more in improving our healthcare system. Naalala ko pa po yung panahon ng pandemya. Maraming salamat po sa inyong sakripisyo sa DOH. Narinig ko na naman boses ni Yusek Berere na kanina nakikinig ako, naalala ko tuloy yung mga first few days of the pandemic. Pero hindi po dahil sa inyo, hindi po natin mararating ito. Lahat po kayo. Sa inyo po yan. Pagkikipagtulungan po ng lahat. Medical frontliners, doctors, lahat. Salamat sa inyong serbisyo. In our effort to further improve our healthcare system, we have passed Republic Act number 11959 or the Regional Specialty Centers Act, no? This is to make specialized medical services available in all regions. At nabanggit po parati na yung mga taga Zamboanga ay pwede na silang paglalagyan doon ng heart center, hindi na kailangan bumiyahe ng Manila from Tacloban. Alam naman natin na napakahirap po rito pumunta ng Manila, wala silang pamasahe yung mga pasyente. Ang iba po, no, sa totoo lang, marami pong nasa probinsya na hindi na po umaabot ng Manila dahil di na nila kayang pumunta rito, magpagamot, magpa-opera. Namamatay na lang po doon dahil sa kahirapan po. Masaya po ako nito dahil priority rin po ito ni Pangulong Bongbong Marcos. Ito pong batas na to. Alam niyo, kwento ko lang sa inyo, nakakuha po tayo ng 24-0 na boto nito sa Senado. Ako po ang principal sponsor at co-author kasama ni Senator JV and Senator Pia. Even the opposition ay sumuporta nito dahil na-explain natin ng mabuti sa kanila na makakatulong talaga to sa mga kababayan nating mahirap. Ang importante ngayon ay masuportahan po nito itong ating mga specialty centers na planong itatayo. Nabanggit na po kanina ilan yung kakulangan, and I heard na kulang talaga yung budget for 2024 para dito. Medyo mas malaki yung inilaan yung pondo para sa 2025 since merong pagkukunan because of the ADB. Am I correct, ma'am? So pagtulungan po natin ito at huwag maantala itong pagtatayo ng ating mga specialty centers. 17 naman po ito, yung plano ninyo all over the country. Sa batas naman ay ilalagay po ito sa mga DOH, existing DOH regional hospitals. At napansin ko the decrease in the proposed funding for our specialty hospitals such as Lung Center, Heart Center, and NKTI should also be addressed. This is probably due to congressional initiatives for this year's budget that were not included for next year. Nevertheless, we should look into this and support additional funding for these hospitals. No? Napansin ko kasi bumaba. And then tataas na naman yan kung dadagdagan ng Kongreso. Tutulungan lang po tayo. I am also advocating for continuous funding for super health centers, which I push for since 2022. Ito pong super health centers, makaka-complement po ito sa programa ng PhilHealth, no? Sa konsulta package ninyo at I'm sure nagdagdag po kayo ng pondo sa PhilHealth para sa mga konsulta. So gamit na gamit niyo po itong mga super health centers dahil dyan na po magpapakonsulta sila at early detection para hindi na po lumala ang sakit. Layunin po ng mga centers na ito, mas mailapit po sa ating mga kababayan ang serbisyong medical ng gobyerno, lalong-lalo na po sa mga liblib na lugar at pinaka-nangangailangan. Sa pamamagitan nito, hindi na nila kailangan pumunta pa sa mga malalaking hospital o sa mga government hospitals. And it will help decongest the hospitals po. Tama yung sinabi ni Senator Lauren kanina, importante po na ma-assess ng mabuti para masiguro na hindi magiging magkakaroon ng kakulangan, no, sa personnel, baka hindi po kakayanin ng LGUs na i-operate po ito. Importante rito maging epektibo at hindi po masayang ang ating mga super health centers. Alam po yan ni ASEC Gorgolon. At bukod sa sapat na pasilidad, equipment, and human resources, importante rin po na bigyan po ng dagdag pondo ang mga programang magbibigay ng direktang tulong pinansyal sa ating mga kababayan, tulad ng medical assistance to indigent patients. Marami sa mga mahirap nating kababayan ang umaasa po sa tulong ng gobyerno kapag sila po'y na-hospital. It is for this reason that we sponsor the passage of Republic Act number 11463 or the Malasakit Centers Act last Congress. We must ensure continued operations of Malasakit Centers. Dapat po walang masasayang na pondo. Dapat po ipakinabangan po ito ng mga kababayan nating mahirap. Ubusin niyo po yung pondo ng gobyerno para itulong sa mga mahirap. I also want to note, Madam Chair, the proposed 19.9 billion funding for the unpaid allowances for healthcare workers. We want to know if the budget is enough to cover the balances due to our healthcare workers. We must properly compensate our health workforce. Naipasa naman po natin yung batas no, itong health allowance nila. At mahirap po maging frontliner sa panahon ng pandemya. Hindi po natin mababayaran ng kahit anuman po ang buhay ng kanila pong sinakripisyo. So, pagtulungan po natin ito. Yun po isang tanong ko mamaya, Yusek Berhere. Ano na hong update nito sa mga unpaid, no, na mga allowances for our health workers. At Madam Chair, we must also give enough focus and ensure funding for our programs to address other diseases such as cancer, tuberculosis, and mental health disorders, particularly for cancer. For this year's budget, we were able to include 500 million for the Cancer Assistance Fund. Next year, we propose to double it to 1 billion. However, I also echo some sentiments that were raised that the program mostly is unutilized pa po, no? Pakisilip niyo po ito. Sa dami po ng cancer patients na nangangailangan ng tulong, sigurado naman sigurong maupos yan at hindi katanggap-tanggap na hindi niyo po magastos yung pondo sa pagtulong sa kanila. We want to know the plan of DOH to address this. Hindi rin natin dapat kalimutan ang sapat na pondo para sa mental health program, lalo na po sa panahon ngayon na marami sa ating mga kababayan na nakaka-experience po ng mental health problems. Madam Chair, mahigit 10 billion po ang natapyas sa proposed budget ng DOH. Kumpara po sa taong ito, maraming programa po ang dapat na mabudgetan natin at may balik. Kaya umaasa tayo, Madam Chair, na madagdagan po ang budget ng DOH. With that, Madam Chair, I endorse additional funding for the Department of Health. Pagtulungan po natin ito. The more we should invest sa ating health sa panahon ngayon. Thank you po, Madam Chair.
Thank you. The questions that Senator Bongo asked were also asked earlier, no? So perhaps they can just submit a written report. Kasi si Senator JV, si Senator Loren, a little bit of Senator Tolentino, all of those questions were discussed. So just give him a written report. But I'd like to assure the chairman that oo, nasagot na lahat. But basically naman, as you know, the funding for the healthcare workers, nandun po yun sa unprogrammed fund eh. So, yung push din natin na mailabas yun, makakatulong. Makakatulong naman din na ma-push natin yun kasi we're all in agreement na gusto din natin malabas. But, and then one more thing is panawagan din doon sa mga hospitals, no? Kasi I understand din that paperwork, we cannot shortcut naman the process. So baka nahiya lang kayo magsabi kanina, pero nabanggit nyo na yan sa akin sa briefing na yung paperwork din ng mga hospitals kailangan masubmit kasi baka yung iba akala nung health worker umaandar yung papers nila at in some cases they're not. So nananawagan din tayo sa mga individuals na who are following up. You can directly inquire from us or from DOH at we can double check na nag-submit din ng requirements yung mga hospitals. Regarding the cancer fund and all of that, it was already discussed naman. We are all one in wanting that funding to be increased. May dadagdag pa ba kayo kay Senator Bongo?
Yes, Madam Chair and Senator Bongo. Isa lang po, Madam Chair and Senator Bongo, about the Cancer Assistance Fund. The reason why zero po ang utilization for 2023 is because kakapirma lang po ng Joint Memo Circular which is part of the law para mapatupad natin. Pero what's good with this, na i-incorporate na po natin with this current JMC na eternal na po itong ating usapan. Wala na po tayong every year na pirmahan ng Joint Memo Circular. Hindi na po kailangan i-renew ang JMC. Every year mapapatupad na natin ang Cancer Assistance Fund without the need of re-signing the JMC po.
Meron pa pong pondo sa ngayon? Hindi pa naubos?
Nandito pa rin ho yung ating para sa 2023. We are just set to implement it because the JMC has just been signed. So that's 1 billion, sir.
Salamat. Ma'am, Madam Chair, yung sa 2021, wala na ho bang backlog doon sa mga health workers natin na payable sa health allowance?
Madam Chair, Senator Bongo, meron pa rin po tayong backlog, no? Kasi meron po tayong retroactive provision dun sa law kung saan I think that was from July 2021 until the end of December na hindi ho yun nabigyan ng pondo. So hanggang ngayon po, hinahanap pa ho natin yung pera. So we have a total requirement of around 113 billion.
Billion?
Opo, para po sa lahat ng kailangan ng healthcare workers. Ang nabigay na po sa atin ng DBM would be 46 billion. So sa ngayon po may kulang pa ho tayong around 66 billion for up to
2021 lang po yan? O kasama na?
Yung kabuuan.
Kabuuan na po. Di ba may unprogram po ngayong taon na ito?
Yes, 52 billion.
May naibigay sa unprogram?
Wala pa po.
So purely puro doon sa sa regular
Program
budget,
funds
sa program
pala.
funds
Yes,
lang po. So nagamit na po yung sa program funds?
Opo, naibaba na po namin lahat.
Pero kulang pa rin ng
Kulang pa po.
billion. Yun ang parati ko pong pinapanawagan sa DBM. Lalong-lalo na po yung mga previous years pa po, no? Na render na talaga yung services. Tapos na po yung pandemya. Sila nga po tinuturing natin na hero ng pandemya. Dapat po yung magawa ng paraan. Kahit na dahan-dahan, mabayaran po sana. At sa 2024, wala na, meron ho kayong inilaang pondo o wala na po? Since lifted na po ang...
sa NEP po, 19.9 billion. Ang nakalagay po, ang naibigay sa amin.
Para sa health,
For 2024 po.
Pero ito po yung pambayad sa...
Karagdagan pa ang pambayad.
Kasi hindi na kailangan sa 2024, di ba? Since
Opo.
lifted na po.
Opo.
So mga payables na po ito. Payables na po. Yun lang po, paki-address po na immediately, ma-process, mabayaran po kagad sila. Salamat po, Madam Chair.
Anything else? Okay na kayo? But can I please ask DOH to take note of all the concerns mentioned, and if merong request for data or ano, pakibigay lang sa office ni Senator Bongo so that kung before the budget, mabigyan siya ng information, no? Okay? Sige. Check ko lang po. O sige, habang nagko-confer pa siya sa staff niya, can you give us an update because it's in the news nitong Nipah virus? There was a report that classes in CDO were suspended, but I also heard a response from DOH that there is no confirmation that that is actually the Nipah virus and it's still being studied. But that is what I read in the news. So can we get a response while you are all here?
Yes, Madam Chair, yes, it's about the Nipah virus. So just to clarify po, there has been this, I think maraming mga eskwelahan ngayon suspending classes or shifting to virtual because of the increasing flu-like illness happening among students. So in Cagayan de Oro, meron hong nag-suspend din ng klase and apparently may kumalat na Nipah virus yung concern. And upon verification with our Regional Epidemiological and Surveillance Unit in Northern Mindanao, wala po kaming confirmed, wala silang confirmed the Nipah virus. In relation dun sa kumakalat na balita, meron lamang po talagang pagtaas ng mga kaso ng flu-like illness. And it's not just happening in Cagayan de Oro. Actually, you've heard in the news, sa Ateneo rin po, grade school, nag-shift sila to virtual because of increasing flu-like illness even in other schools in the country. So nagpalabas na ho kami ng advisory in terms of this. But in terms of Nipah virus, Madam Chair, there has been this incident, I think 2 weeks ago sa India, which was part of the news coverage where there were deaths and apparently nag-lockdown. Pero nung pinag-aralan naman ho yung kaso, tinignan natin kung ano yung ginawa, it was really part of their response. No? Hindi sila nag-lockdown, nag-trace sila po at yung pong malapit doon sa area na na-identify yung suspect case, sila po ay nag-intensive quarantining and isolation of the individuals who were exposed to this person. Dito po sa Pilipinas, wala ho tayong detection. Meron ho tayo nung huli in 2014 in Sultan Kudarat where there were a number of individuals in a community na na-detekta nito. Pero sa ngayon po, wala tayo na-detect pa. It's coming from bats, yun po yung primary na source ng infection, yung pong sinatawag na Pteropus bat. Sabi po ng Department of Agriculture, Department of Environment and Natural Resources nung nakipag-meeting kami, prevalent daw ang fruit bats na ito all over the country. So it's really very hard for us, difficult, para gumawa tayo ng mga isolation or quarantining for this purpose. So ang ginagawa ho natin ngayon, generalized measures tayo. We've activated our Philippine Interagency Committee on Zoonosis, kung saan nandyan po ang DA, DNR, DILG at saka iba't iba pa hong mga ahensya at nag-usap na tayo kung ano yung measures na gagawin. Our first measure would be to issue a general advisory coming from all of these agencies together with DOH para po hindi magpanik ang ating mga kababayan. Pangalawa, ang DNR po ay nagko-conduct na ng random surveillance sampling among our bat population and they are issuing advisories already na mag-avoid muna yung mga tao going to this maraming mga bats na mga habitat. And then the third would be ang DA naman po kasama natin kasi second reserve one itong sakit na ito o yung mimiksa ng sakit ay mga baboy ang sabi una, pero meron din po sa kabayo at in the recent experiences from other countries pati aso no nakikitaan. So ito po lahat ay minomonitor din ng ating Department of Agriculture together with that. But just so Madam Chair, I just like to say, we don't need to panic. Kailangan lamang po yung ginagawa natin during COVID, washing of hands, you can wear your mask if you're vulnerable, kasi nakukuha natin to through close contact or droplet infection also, and from the fluids of bats. And thoroughly washed the fruits and the food that we eat, especially those that we get from our backyards, kasi maraming akong fruit bats dito sa country natin.
But given that, what is it predominantly transmitted by bats? You said nga it's not only bats. So would you say that if you're a city dweller, then the chances that there are bats there are less and therefore less, or you don't even want to make any pronouncements like that?
Yes, no pronouncements, ma'am, because assumptions might lead to...
Mahirap
yes,
yung ano.
opo,
Okay,
fear.
baka biglang magdagsa sa city dahil
Opo, dito
sinabi
na
ko
sila
daw
dito.
na walang bats dito. So, hindi natin ho sinasabi yun, nagtatanong lang naman.
Pero kailangan din po kasi maintindihan ng mga tao kung saan siya galing. So maari po kasing manggaling lang mismo siya sa bat, like may droppings yung bat or kumain siya ng prutas, tas nalaglag yung kalahati nung kinakain niya, kinain ng bata, maari rin po. And maari rin pong yung ma-infect ng bat yung isa pang hayop, katulad ng kabayo o kaya
Yeah, like
ng
you said.
baboy o minsan yung aso sa ibang bansa. So yun po, kailangan malaman ng mga tao na doon natin nakukuha kapag close contact with those affected o di kaya ay nalanghap mo rin yung hangin pag close contact mo. So kailangan lang laging nag-uugas maigi ng kamay, nagsasabon, nag-mask ka kapag vulnerable ka,
Okay.
saka ugasan maigi yung mga prutas po, mga pagkain kinakain natin.
And makinig sa mga announcements ng DOH at kung hindi sino-sino mong favorite na kung sino man sa TikTok, di ba? Kasi dyan kumakalat ang mali. Hindi, kasi we have to still function as a normal society. Kailangan pumasok yung pumapasok, kailangan pumasok sa school ang mga bata. So hindi tayo pwedeng nagpapanik. Okay. All right. Senator Go, if you don't have anything else, I will proceed. Yeah, you're okay? Okay. I'd like to just touch on a very few matters. I noticed nobody availed of my mobility break. Okay? So, I need you all to be mindful of your own health. In as much as alam niyong masama yung sigarilyo, alam niyong umiwas, hindi naman bawal, pero umiwas to sa mga pagkaing nakaka-affect ng health nyo. Ako naman yung magpapangaral sa inyo na kung sinabi na sa inyong feel free to stand, di ba sabi nga, sitting is the new smoking. So, di nyo naman inavail yung ano ko. So, tumayo kayong lahat ngayon. Tumayo kayong lahat. Kasi mahaba pa to, hindi, konti na lang to. But di ba, yun naman yung ano ko, tumayo lang kayo lahat, mag-unat-unat, kasi alam niyo yung mga upo na ako kasi sabi ko nga yung nagsasalita dapat nakaupo. So, feel free. Ayan. Actually, kanina ko pa hinaharap si Dr. Ayag kasi very siya. I'm a fan. Very effective yung kanyang mga interventions to get people to pay attention dun sa advocacy niya kung ano man yon. Kaya kung hindi nyo siya gagamitin for that purpose, gagamitin ko siya. So, feel free to stand. You may sit, pero kayo magmadaling umupo kasi honestly, ako mas masakit ang katawan ko pag nakaupo ako na matagal. So, I really just wanted you to be free to do that. And marami sa inyo, hindi rin nag-restroom break. Bahala kayo pag sumakit ang tiyan nyo. Ano ba yung sinasabi nila nung matatanda? Ano ba yun? Pagbasa, pag hindi kayo nag-CR ng regular, whatever. Okay. Anyway, feel free to stand, feel free to sit. It's up to you, but I just wanted you to avail of that. It's a habit. You have to be in the habit of standing and moving around. I just wanted to get the details of health. Health is life, but not now. Please submit it to me. I'm just excited. Is that your project? Okay. So I want to get that. And then maybe before the budget lang, to prepare me in case may magtatanong, naalala ko kasi yung discussion namin ni Secretary, yung nagbubuhos ng pondo sa MAIP, and yet, so parang nagiging dependent ang mga tao sa interventions na ganon, when in fact, we should really be utilizing our funds for the, other ways of delivering health service, yung upgrading the facilities, ayusin nga itong case rate natin and improving it and so on and so forth. So I'm a supporter. I am a believer in preventive healthcare. So any other interventions that any of you, and I note the specialty hospitals pala, special greetings po to all of you. I'm always mindful of your request for additional budget. Please feel free to talk to my staff, but just to recognize your presence here, si Dr. Joel, of course, was able to speak earlier sa Philippine Heart Center. Of course, Dr. Rose Liquete from NKTI, kamusta po kayo? And then Dr. Vincent Balanag of the Lung Center. Sir, kamusta kayo? Who did I not mention? From Philippine Children's Medical, Dr. Sonia Gonzalez. Hello, welcome. Sa Philippine Institute of Traditional Alternative Healthcare, Dr. Annabel de Guzman. There you are, welcome. And National Nutrition Council. Hello, Dr. Azucena Dayanghirang, the Assistant Secretary and Executive Director. And then Philippine National AIDS Council, Dr. Joselito Feliciano. Hello, welcome. Welcome all of you. You can continue to dialogue with my staff, but don't forget there are senators who are passionate about individual sectors that you represent. Merong sa children, si Senator Bongo, lahat yan. So, wala siyang pinipili basta pagdating sa health. Pero may iba dyan sa atin na passion nila yung sa HIV/AIDS, no? Yung iba naman, could be sa heart, no? Because of personal stories and experiences sa kidney. Si Senator Lauren was mentioning nutrition a while ago. Feel free to write to these senators who you know are supportive of your causes kasi nakakatulong din yung lobbying for your funds naman, no? And of course, you have our support naman. Kahit papano, we always help. But don't forget yung utilization nyo kasi hindi namin kayang labanan yun. Kung hindi nyo na-utilize yung funding nyo, we are not able to push because babawasan din ng BBM yun. Okay, so let me go to a matter lang that's close to my heart also. And I will request the presence, baka somebody can make room for her, for Dr. Aleli Sudyakal. There you are. Okay, baka you can just make space for her. As Yusek Vergere knows very well, no, I do not have the time, but I try to ensure that the delivery of healthcare is not limited to the laws that we pass, no? So to that extent, I just want to bring up, because very important po ito sa delivery of healthcare, to certain to Filipinos living in the area of Taguig and Makati, and to a certain extent the rest of Metro Manila, because hindi naman namimili, no, ang mga health centers natin kung sinong tinutulungan, di ba? Wala naman tayong tine-turn away kung taga saan man sila. So can I just confirm with you, Dr. Aleli, that ang goal naman natin sa DOH, pursuant to the Supreme Court decision giving Taguig, no, jurisdiction over certain areas previously part of Makati, we want a smooth transition for 8 healthcare centers. Tama ho yun?
Yes, Madam Senator.
These are 8 health centers previously in Makati and now in Taguig's jurisdiction.
Yes,
And
Madam Chair.
nagkaroon na ng usapan between the 2 mayors, correct?
Yes po, Madam Chair.
And is it correct, is my understanding correct that the date of September 30 was recognized as the last day for Makati to be operating those health centers, and thereafter it would be turned over to Taguig City?
Yes, Madam Chair.
So tama yun?
Opo. Madam Chair, if I may just add.
Of course.
Opo, that agreement was
arrived at in a meeting that the DOH convened last September 11. The two mayors were not present, but they were represented by their legal counsel.
Okay.
And it was in that meeting that Taguig, Makati agreed to pull out
Okay.
its resources on September 30, that's a Saturday, and following day for Taguig to avoid any kaguluhan po na mag-abot doon, Taguig to enter the 8 health centers in the disputed area. And unfortunately, by the end of the meeting, the legal counsel po of Makati offered a draft MOA, which they developed, and it was agreed that they will share it the following day. So they shared it the following day, and Taguig was supposed to review it after a week. As expected, there were some provisions in that MOA that Taguig objected to, and which led to Taguig pronouncing that it will not sign that MOA.
Can I further clarify that based on the agreement of September 11 that you referred to, no? You're the one who mentioned the September 11 date. It was agreed that isi-set aside muna, hindi muna pagtatalunan ang ownership ng Ospital ng Makati. And Dr. Gloria Balbao, let the record show, is nodding, Balboa, sorry, is nodding her head. That is correct, right? That is the agreement, di ba?
Yes, Madam Chair.
Oo, so basahin ko, no, kasi there's a letter here, actually signed by yourself, right?
Madam Chair.
Dr. Aleli Sudyakal, no, Director 4. It says here that during the above-mentioned meeting, referring to the September 11 meeting, the MMCHD, which is the Metro Manila Center for Development, emphasized that discussions on ownership and on the Ospital ng Makati were to be set aside for a later date. So this MOA that you're now referring to, that was drafted by Makati, is now discussing ownership issues, di ba?
Yes, Madam Chair.
Yun na nga. So will you agree na pursuant to that September 11 meeting, kaya nga kasi para lang iset aside, para lang hindi ma-disrupt ang services ng health centers servicing the people in that area, wag mo nang pag-usapan yung mga ownership. September 30, and am I correct in my understanding that September 30 date was requested by Mayor Binay?
Yes, Madam Chair.
Correct. And then, pumayag ang Taguig. So the reason why, and you're stating now na hindi komportable ang Taguig sa MOA is because hindi yun ang pinag-usapan. Hindi yan ang lahat ng sinabi mo, hindi naman yan ang lumalabas ngayon sa MOA. The ownership issue and yung hindi na magto-turn over ng September 30.
Yes, Madam Chair.
Okay. And this letter of yours further states that we are positive that the two cities continue to recognize the need for all involved to settle this issue at the soonest possible time, referring to the previous paragraph, which the previous paragraph states that, yun nga, yung sinabi ko na the ownership on the Ospital ng Makati will be set aside for a later date, and one of the highlights of the said meeting is the reiteration by the City of Makati of its intent to pull out from the 8 health centers on September 30. So your letter states that it is the City of Makati that made those pronouncements to give way for the entry of the City of Taguig on October 1, 2023. So that's it.
Opo, Madam Chair.
Tama? Okay. So if Makati does not pull out as agreed in September 30, di pa paano? Mag-e-extend? Hindi naman yun. Paano ba yung delivery? And I mentioned from the start, this is just a Supreme Court, it's just a Supreme Court decision that we are implementing, correct?
Yes, Madam Chair.
So dapat as discussed, hindi mapag-usapan muna yung ownership, di ba? Kasi if I remember, and I wish that Secretary Ted was here, but ang intindi ko is Secretary Ted will handle that issue. Or at the very least nga, iset aside. So I don't want you to answer for Secretary Ted. You cannot. But I'm just saying na yun ang intindi ko, he will handle the issue. And your letter, and you have stated that ang napag-usapan is set aside muna ang ownership of Hospital ng Makati so that the barangays can continue.
Yes,
So yun lang din ang aking concern, no? Because as chairman of the Committee on Health, as chairman of the committee on, vice chairman of the Committee on Finance that handles the budget of DOH, it's the delivery of these services that I'm concerned about. Eventually, kahit sino pang barangay yan, pag humingi ng tulong sa akin yan, hindi naman tayo tatanggi. Ibabato ko din sa inyo kung may meron kayong matutulong, no? Because even though these areas are in Metro Manila, meron din tayong mga urban poor dyan na kailangan matulungan. Okay. Thank you for that.
Thank you po.
Okay, so I will leave you all with this. There is no objection to your budget, but I think there is a lot of preparation we still need to do for the budget for PhilHealth. For the President, this is your first budget hearing. So konti lang ang nag-attend ngayon, pero it doesn't mean na hindi lahat ng senador magtatanong sa pagdating sa November. So let's be prepared. My staff will reach out to all the senators' office to find out if they have any concerns, and we will organize pocket meetings for you para yung mga respective agencies or maybe mga attached agency can be available if needed. And if not, as I said, yung mga appeals nyo, feel free to deliver, to push for it kasi we try to support as much as we can. So on that note, we thank everyone for their time. And muna kayo pumalakpak, meron pang November eh. Thank you for the time, and may I ask for your commitment sa susunod na mga meeting nyo. Huwag kayong mahiyang tumayo. Magpaalam kayo sa ano na, kayo dapat ang una eh. San ba yung last na napuntahan ko na natuwa ako na there was really also a mobility break? Where were we? Tayo. Ano nga ba yun? I was in, hindi matagal na yung Korea. Ito lang. I was in Malaysia just a week ago for a Futures Thinking conference. And natuwa ako they had the mobility break. Iba pa yung snack break iba yon Iba pa yung snack, iba pa yung mobility, tapos iba pa yung breastfeeding break, lahat yon iba-ibang klaseng break. Tsaka yung son ko ngayon, may mental health day na rin sila, kaya lang tumapat sa bagyo. So kulang daw yung kanilang break, isa pa daw break ulit. So on that note, the proposed budget of the Department of Health and its attached agencies and corporations are deemed submitted to the plenary.